Okay, thank you. So committee is back in order again, and members, just, we voted to advance that working draft 64. Had on my notes, and then I was working on the online where my notes, but I just want to bring this to your attention and see if you want to correct it now, but it's on page 2, line 8, all those different establishments. And then you can see the staff note. So the microbreweries, wineries, distilleries are not in what we passed on line 8. And didn't know if the committee if the committee wants to correct that now, we could simply just, I think, a motion to reconsider in the affirmative, lay it back on the table and fix that, and then take another vote and
Mr. Chairman,
put the thing to bed. So what's the committee think on
I
that?
would move to reconsider.
So Senator Pappas, motion to reconsider that bill. Anybody else? Second? Second? Okay. Second by Representative Roscoe. So really what?
I think you need a roll call.
We need a roll call on that. We do. Okay, can you please take the roll? Motion to reconsider on 64. Go ahead.
Senator Baldwin,
Reconsider.
Yes.
Reconsider the last bill.
No. We gotta fix something. Oh, we gotta fix something? Well, all right.
Senator James,
You just don't want more work.
Senator Pappas,
Aye.
Senator Schuler, Representative Baker, Representative Gray. I'm sorry, could you repeat that, Representative? Representative Hallinan,
Reconsider.
We're voting to, motion is to reconsider to fix that language on page 2, line 8, the staff note that's on there. Have all these establishments represented, but we left out microbreweries, wineries, distilleries.
Representative Henderson,
Excuse.
Representative Jennings, Representative Roscoe, Representative Sweeney, Representative Yin.
Aye.
Co-Chairman Case,
No.
Chairman Harshman.
Aye.
The motion to reconsider passes.
Okay, so on line 8, page 2, have a motion on that? Anyone like to make a motion to include wineries, breweries, and distilleries? Senator, okay, Senator Baldwin makes a motion. Is there a second? Second by Senator Schuler. Okay, any discussion? Include basically the staff note with distilleries.
Mr. Chairman,
Okay, Representative Jennings, discussion?
could I get the maker of the motion to explain how this works into the bill? How does this, what does that look like before we vote on it?
So an explanation of those three, how it works in the bill? Because that, I couldn't quite hear you, so.
Could we get the maker of the motion or LSO to come up and show us what this looks like in practical application?
I'll have Mr. Anderson come up and give you the statute references.
They're right there, 14 and 15.
Sure. Sorry, Mr. Chairman.
Yeah, 2 of them are right there in the staff note, and then distilleries, I think, is missing that. Go ahead.
Yeah, so Mr. Chairman, if you start on page 2, line 7, and you see those statutory references, those are retail, liquor licenses, club licenses, resort license, restaurant license, and a bar and grill license. And so we had noted that some other licenses in that same area that weren't included were microbreweries and wineries, if the committee wanted to include those. And Chairman Harshman also noted distilleries. And so that motion would be to add those 3 permit references to that list of statutes.
Okay, thank you. Any further discussion?
Mr. Chairman,
Ms. Representative Sweeney?
so if I could ask, and probably Mr. Mosier might be the best example, here in town, we have a quote-unquote tasting ability or a tasting room, so which is part of a art. You go in and paint pictures. And in order, they felt it necessary to have wine along with that. So would this apply when it says winery? Would it apply then therefore to a tasting room? And I see that's
Affirmative.
affirmative. Okay.
Okay. Any other questions?
So, Mr. Chairman,
Representative Jennings?
so if as I'm reading that and on 6 and 7, correct me if I'm wrong here, we're obviously we're dealing with the truck stop aspect, and we're wanting to limit this to, because of the question of age appropriateness, we're now wanting to add in microbrewery and wineries so that they can have gaming things at their events. Would that be correct?
Yes. So they're just like the other alcohol establishments that are 21 and over. That's my understanding.
So, Mr. Chairman, so when,
Go ahead, Representative Jennings.
so if they're having let's use the taste test. They might have an event outside and they're just gonna bring, theoretically, they're gonna bring this gambling or this gaming thing also? Is that what we're voting on, that we're gonna make that available?
I think if on line 6, it's licensed and permitted to sell alcohol, liquor, or malt beverages. So that's place of business, single physical establishment, place of business. Starting on line 4. Okay, any other discussion? Go ahead, Mr. Co-Chair.
Mr. Chairman, I think that just mirrors what we consider to be establishments in the law now with respect to alcohol sales. But, I'm not going to vote on this one because I do have an alcohol license, and it's not connected to winery or brewery or anything like that, but I just not going to do that.
Okay, sounds good. Okay, any other discussion? We ready to, Mr. Sweeney, Representative Sweeney?
Sorry, Mr. Chairman. So any thought process, we have a number of pop-up microbreweries here in Casper, and I'm sure they're, just fine. But do we actually specify how many barrel system? Somehow define that, because I worry about, typically, these are regulated through ATF and other mechanisms, but I would hate to see a home brewer expect to be under this, so I would just worry about
Permitted is.
step too far.
Mr. Chairman. So the word permitted means they have a license. It's not, these are regulated businesses by the local licensing authority. So they have a liquor license of sorts.
Okay, any other discussion? Since you're ready to vote, all those in favor of this amendment, please raise your hand. 1, 2, 3, 4, 5, 6, 7. All those opposed, raise your hand. 1, 2, 3, 4, 5. Representative Jennings or Henderson is opposed on line 5. So that motion has passed. Okay, I think we're ready. Are we ready, members, for a question on the bill again? Okay, so if we please call the roll on LSO 64 as amended.
Senator Baldwin. Senator James. Senator Pappas.
Aye.
Senator Schuler. Representative Baker.
No.
Representative Gray. Representative Hallinan. Representative Henderson.
Aye. Anderson, aye.
Representative Jennings. Representative Roscoe. Representative Sweeney.
Aye.
Representative Yin.
Aye.
Co-Chairman Case.
Aye.
Chairman Harshman.
Aye.
That's passed.
Okay, thank you. Okay, we're now on LSO draft 65. Is there any public comment on 65? We've had the bill presented. Any public comment on 65? Any additional? We've had public comment. We certainly welcome more if you have any. Okay, is there a motion? We're going to close.
Mr.
public-
Chairman.
Go ahead.
Right before lunch, Senator Case moved that we move that to our next meeting.
Oh, yeah, yeah.
With an amendment.
I got a good memory, but it's not very, it's short. Yeah, I remember now. Goodness gracious. Okay, thank you.
But
I got it now. I
I
remember. this.
objected.
Goodness gracious, you're all looking at me like, what's, okay, I got it. Okay, we're out now on, next agenda item is the 988 Suicide and Crisis Lifeline Funding. Okay, no presentation by staff. I'd welcome public comment. Please come forward, introduce yourself. We're so glad you're here. Talk about this important issue.
Thank you, Mr. Chairman, members of the committee. Andy Somerville, I'm the Executive Director for the Wyoming Association of Mental Health and Substance Abuse Centers. I know many of you are familiar with seeing me on a regular basis, but I appreciate the opportunity to see a different committee for a minute.
Ms. Somerville, appreciate, are you a former elected official?
Mr. Chairman, yes, I am.
I was throwing you a softball there early. And that office was,
I survived.
and your office formerly was?
Mayor of the city of Laramie.
Okay, very good. Okay, well, welcome to the committee.
Mr. Chairman, with your permission, I have a short presentation to kind of walk through some of the mechanics.
Mr. Chairman, while she's presenting or getting ready, I think this would be a good time too, that we've been invited to mental health, I think, conference here in Casper, it's October 10th. Is that right? So is that right? Oh, the 11th, yeah. So this would be a good time to just bring that up and invite people to that too.
Thank you. Okay, Ms. Somerville.
Thank you, Mr. Chairman. Just kind of an inventory. I've given you guys a lot of handouts. There's a lot of good information in here. Some of them I'll reference, but some of them are just to answer general questions to try to keep the topic a little bit more streamlined on funding as to the mechanics of mental health, but obviously always willing to answer any questions. So we're here to talk today about 988, which went into effect July 16th, 2022 this year, all the way across the country. 988 is the new 3-digit number that replaces the old 800 suicide lifeline. So why we have a lifeline in 988, just to give a very brief refresher, in 2020, there was a suicide every 11 minutes in the United States. Wyoming has consistently ranked in the top 3 in suicide per capita for the last 10 years, and I believe the last 3 years we have been number 1 in the United States. So we're certainly right there in the middle of this. These are our death by suicide trends over the last 10 years. You can see we did have a dip in 2014, but they continued to climb. Certainly a lot of factors there that I won't get into, but it's a disturbing trend and it has a significant impact on our communities, our employers, our families, et cetera. In terms of cost, this being the Revenue Committee, I thought this would be good information to share. Each death by suicide costs the state of Wyoming approximately $1.3 million in medical costs and lost work life, basically. A very small percentage of that, probably less than 5%, is the medical costs. The rest of it is lost wages and earnings from losing that person. In 2021, we lost 3,618 years of what we call potential life before the age 65 in Wyoming. That's a lot. That's pretty high in the United States. And I would be remiss if I didn't bring up that certainly law enforcement are our strong partners at the table when working on suicide prevention, and they spend considerable resources on mental health calls for service in all of our communities. So let's talk just a little bit about 988. This is a history. 988, or the Suicide Lifeline, is actually not all that old. You can see it started with some congressional action in 2001 and has slowly made upgrades and changes as it's gone along through the years. So after 2015, when they added the disaster distress helpline designation, they started to investigate the possibility of moving to a 3-digit number to make it easier for everybody to remember, similar to 911. This process took some time, but in October of 2020, President Trump signed the National Hotline Designation Act into law after the FCC confirmed and set up their rules, and so here we go. And we've been on a 2-year journey to try to walk through that in terms of what implementation looks like with the feds, with the Department of Health, all the partners at the table. It is now fully active in Wyoming, so you can dial 988 from any cell phone, landline, voice over IP, anywhere. I will also mention you can still dial the 800 number. It will still get you to the Suicide Lifeline. Lifeline works very briefly that you dial the number. Right now there are 2 sub options. One is for the Veterans Crisis Line Network that was added a few years ago through some action. And then there is a Spanish sub network right now in terms of trying to get people to where they might receive the best help. They are certainly in talks about how we continue to grow those resources, but right now, those are the options. You're connected with a local crisis counselor who will talk with you, work through issues, and then work through referrals to service, outpatient, or maybe it's more emergent, or at the end of the severity scale is potentially doing what we call an active rescue with law enforcement. Wyoming was the last state to bring in a local call center. So before August of 2020, all calls that came from a 307 area code phone number bounced to another state that had capacity. California, Texas, Vermont, didn't matter, whoever had capacity. While that's better than nothing, those call centers, those crisis counselors lack the resources beyond a Google search in where to get help in Wyoming. So we were very fortunate that the legislature allocated some funds in the 2020 session to start us down this path. Right now, as of today, currently, we have 2 call centers that are taking calls. One's in Casper, the other one's based out of Grable. And from my perspective, we're seeing some results. We're seeing some direct connection into services, to crisis stabilization, and working directly with our local law enforcement on active rescues to try to kind of dial down those scenarios and try to aid law enforcement in those situations. We know that 988 works. I won't inundate you with this. I think I sent out a lot of research at the last session when we were discussing ARPA money. Wyoming call centers are currently handling approximately 500 calls a month. It varies from month to month or so, but that's a significant number of calls. It is not unusual to have several calls in a week that are an active rescue or at the severe end of the scale. So the good news is we are getting people in Wyoming. The only caveat I'll add to that is there is still some work to be done on how those calls are routed through the federal network in terms of geolocation. Right now, it's still currently based on area code. So if you have a 307 phone number and you might be in, I don't know, South Korea on vacation, and you try to dial that number for some reason, you'll get into the Wyoming call center. Or if you're in Florida on vacation, you'll get the Wyoming call center. The federal government is working on moving that to be a digital geolocation, similar to 911. We're not there yet, but they're working on it. What we're going for in terms of mental health service providers is something that looks like this. And these are, some of these elements we don't have yet. Some of them are new. So the crisis line in Wyoming is new, but you can see, we'd like to see 80% of these calls resolved on the phone. That's warm handoffs into outpatient services, referrals, and sometimes people just need to talk, and that's okay. Our call centers will talk to them as long as they need to. They will call back and follow up with them day after day if that's what it takes. In the case where something needs active action in the field, but it's maybe not quite at the law enforcement, the ideal situation is to have mobile crisis teams. We don't have those in Wyoming per se yet. There was a small pilot in a southeast county in Wyoming a few years ago, but unfortunately our economy of scale here makes this incredibly difficult, along with our territory. That is something we hope to do in frankly the near future. In the next couple of years, is frame up a model on how we can make that work in Wyoming. I can almost guarantee you telehealth will be involved in some fashion. Of those people that need to be taken into crisis, 65% of them, we get them in and we stabilize them, we get them connected into the services, and hopefully we are discharging them back in their communities, to their families, keeping them in their jobs, et cetera. And you can see this number, this 85% remains stable after going through that process. That is amazing. It's not just amazing for our communities, but in terms of resource use. I love this graphic with the jails and the emergency departments and the inpatient psychiatric, because that's where the costs really start to rack up, and that's what we're trying to drive down. And this model really seems to support that. So we'll talk a little bit about funding 988 in Wyoming. So we got an allocation from the legislature to the Department of Health of about $400,000 that provided part-time center hours for 2 years. In 2021, the centers received a $60,000 planning grant. I believe that was split between them. In 2022, the state was awarded a $250,000 implementation grant. That's the floor grant. A lot of this money goes out based on population, and unfortunately, we get the floor. So that is a 2-year grant from SAMHSA that's supposed to cover 22 and 23. And then in this session, the legislature again generously allocated $2.1 million in ARPA plus $400,000 in the general fund budget for public health to provide 2 years of 24/7 service. Now that last box, that's the question. So in discussing 988 funding with a lot of stakeholders, including legislators, the question is, how do we keep it sustainable? Because we know it's a critical safety net service to have in place. We don't have an additional revenue source to fund this. Certainly, I would sit here on the other end of the table and tell you guys that we don't have enough money in mental health in a lot of areas. And so it really becomes critical to figure out how to fund this sustainably, and there's only a few options. I'm gonna skip back a slide here. So in terms of funding options, there is the state general fund, which I put on the bottom as the last resort. There are grants as available. What we know about grants is that both call centers in Wyoming have been able to secure some small dollar grants to help run stuff. It's very small money. We don't know what the grant landscape looks like in terms of potential money coming from SAMHSA or another agency. There are a couple of other alternatives that are not probably very feasible in Wyoming around potentially like certified community behavioral health centers. There's a Medicaid component for crisis, et cetera. We don't have the components in place in Wyoming to move to that yet. And then, of course, there's the 988 fee. So in your stack of papers, there's a copy of the legislation that was signed in October of 2020. And the two important things that I'll note in this legislation is that it only pretty much outlines one revenue source for 988, and that is to give the authority for states to assess a fee similar to a 911 fee on a telephone bill. voice over IP, cell phones, prepaid cellular, landlines, et cetera. So it gives the state the authority to do that. To do that, we would require legislative action to establish that fee and move that forward. The other thing the bill does is outline 3 very specific components about where the money can be spent and requires pretty hard sideboards on that. You can collect that fee and spend that money to support 988 Crisis Center staffing and operations. You can support what they call outreach crisis, which is mobile crisis essentially, and you can support crisis stabilization services. That's it. The money can't be used for anything else. And they're pretty specific in the legislation about requiring to keep those sideboards on and the money segregated, accounted for, reported, et cetera. So in terms of, it was not my intent today to maybe discuss a specific fee or cost. I really wanted to tell you what was out there as an option. But we estimated $1.25 million a year to provide 24/7 coverage. So the $2.5 million that we were allocated for these next 2 years, it does not include mobile crisis or crisis stabilization. That's just the call center operations. When we look at future funding, with the rollout of 988, the federal government's education campaign will really kick up later this year. They kind of did a soft open on it in July, and you're going to start seeing more and more and more. In fact, I got a 988 flyer from the Department of Health in my mailbox, I think 2 weeks ago. So we're starting to see it. With that, they are projecting an increased call volume. On the low scale, that's 1 to 4%. On the mid scale, that's 7 to 8%. On the high end, if it really takes off, that's 15% increased call volume per year. So that's something that we need to account for in terms of our call center operations. Unfortunately, we don't know what that'll look like. Now in Wyoming, again, in terms of a scale compared to a large state, we're dealing with a much lower number of calls, I should say. But it's still something that needs to be accounted for because our goal is to answer every single one of those calls. We don't want to bounce any of them out of state if we don't have to. So we need to have appropriate staffing. Ongoing implementation and planning work, such as working on mobile crisis, potentially, or looking at crisis stabilization, and then future infrastructure. I mentioned the geolocation. I cannot sit here and tell you any information today about what that might look like for Wyoming or what we need or what we don't need. I imagine that's going to come years down the road. I don't expect it in the next year or 2, but it'll come at some point in time to make the system operable. I just wanted to give you guys kind of an overview of why we asked for what we asked for last session for the ARPA money, which we are very grateful for because it gives us this 2-year time to have a conversation about potentially how we do this going forward. So our recommendation is that we're asking the committee to look at drafting language based on what I would call the revised model legislation. Now, you've got 2 documents in front of you as well. One is the one that says NASM HPD, National Association of State Mental Health Program Directors. That is the national model legislation that the states that are working on this are starting to work off of. I wanted to provide that to you in full because the other document that you have, and I apologize for the small print, I will get that back out to you guys, is one that says 988 crisis line. It's kind of hard to read and you should have an electronic copy in your inbox. I apologize, it didn't print right. It looks like that. This is essentially this bill with a few modifications that we have put into, because we think that it's important to be realistic about what Wyoming can maybe do in this sense. For example, this bill does not include a requirement to establish mobile crisis teams. We are recommending you change that to we may establish crisis teams to give the Department of Health and the stakeholders time. This bill also specifies what will be in a mobile crisis team. It is unlikely that we would be able to meet those standards without a lot of money to be able to make that work. So we removed that piece of it. There is no recommended fee in this draft. That is, again, something for the committee to discuss if the bill moves forward. So I wanted to put both of those before you, but we think what's important is that We specify that mobile crisis teams can be used, or may be used. We can specify funding can only be used in compliance with the 2020 988 Hotline Designation Act. Again, those 3 specific categories. And the model legislation does a really good job of cross-referencing all of the federal requirements that are in that bill, so I did appreciate that. We're asking that you designate the Department of Health as the primary oversight and require regular reporting back to an appropriate legislative committee as this program goes forward and develops. I think it'll be important to check in on what are we doing, what impact is it having, what does the funding look like, are there gaps, et cetera. The bill would establish a fee if that's the committee's pleasure on landline, mobile, IP, voice-enabled, and prepaid telephone services. And then probably the most important is establish a 988 trust fund for those dollars in the state of Wyoming. We would recommend in a scenario where this moves forward, the call center operations really need to be the first priority as we start to kind of walk down this implementation work. We would recommend that any additional funds that were collected remain in that trust while the department works on mobile crisis and crisis stabilization services. Mr. Chairman, with that, I thank you for my time, and I would be happy to answer any questions.
Good, thank you for your presentation. Members, do you have any questions for Ms. Somerville? My question is, have you done any kind of estimates, on a phone fee, what that is for Wyoming? Is it 2 cents, 5 cents, a buck? What is it?
Mr. Chairman, in looking at estimates in terms of cost, if you asked for a recommendation today, it would be at about 50 cents per phone line. The larger states, certainly with more populations, I've seen some lower fees than that, but I've also seen some higher fees being proposed. It really depends on what the legislature would like that fee to pay for. 50 cents would pay for our call center operations and then give a little bit of money left over to start work on mobile crisis and crisis stabilization as appropriate.
So then and then I don't want to hog all the questions here, but then to establish a trust fund though, to just kind of crank out $1.5 million a year, 30 million bucks, kind of quick math on okay, so 30 million or 50 cents a phone. Okay, it gives us some ideas. Okay, questions of Ms. Somerville. Senator James, and then Senator Schumer.
Thank you, Mr. Chairman. So I was wondering, how about a fee to the hospital districts, since they're the ones who will benefit from the patient intervention in the field? This way, the patients will not come into the ER for expensive treatment. Hospitals can contract with the center to bill Medicaid and be reimbursed for telehealth crisis interventions. We also want to make sure this law doesn't designate a specific vendor to accomplish this task. Also, how about making room for a director of nurse practitioner who can bill for services and oversee their operations to make certain they are providing evidence-based treatment over the phone? Have we looked at anything like that?
Thank you, Mr. Chairman. Senator James, so a few things on that. In terms of asking the hospital for financial support to help make this work. Oh, sorry, excuse me. Thank you. Hospital district. I don't know of any conversations specifically with a district board, but what I can tell you in general is that hospitals do work with the community mental health centers and other mental health providers because this does impact them. A lot of times, a first contact for somebody who's in a mental health crisis, and this line is not just for suicide anymore, it's for mental health crisis as well, is with law enforcement and a lot of times the emergency departments. They certainly, I'm not going to speak for the hospitals themselves, but have expressed concerns that they are already bearing quite a bit of cost in terms of the mental health crisis in unreimbursed care. I would add that our centers or the providers of those services can bill Medicaid and will bill Medicaid. The state is the payer of last resort, so we would go through private insurance, Medicaid, the whole 9 yards before we go down to that. And then, Senator, to your last question, in terms of ensuring evidence-based practices, that is absolutely critical. And I appreciate the reminder because it's a great question. In the bill, both in the model and the one that I slightly modified, it requires a call center to adhere to national practices, and it's pretty specific in that bill. It is critical that we are ensuring that we are providing top quality service and top-notch service. But I would, at this point in time in Wyoming, these call center counselors are not master's level clinicians most of the time. They are usually at an associate's or a bachelor's degree and go through an extensive battery of training to do that first piece. They're not there to treat a mental illness. They are there to triage the call and make sure that that caller gets what they need and gets where they need to go. I don't know if I answered all of your questions.
I think Senator Schuler had a question.
Thank you, Mr. Chairman. Actually, you asked some of the same questions that I was going to ask, so I don't need much more information other than I wanted to know what the fee was for the 911 call. Is it similar to what you would be looking at for 988?
Mr. Chairman, Senator Schuler, I apologize. I should have brought that with me. In Wyoming, I believe 911 fees are designated on a county by county basis, and they sometimes vary, but I can get that information back to the committee quickly.
Very good. Okay, members, any more questions for Ms. Somerville? Okay, Representative Sweeney.
Thank you, Mr. Chairman. So on the payment and cost sharing with the hospital districts, I'm just curious, how would that work with uncompensated care with folks that don't have insurance? When you talk about Medicaid, I'm just uncertain how that would work.
Thank you, Mr. Chairman. Representative Sweeney, so in terms of uncompensated care for what we're talking about here, suicide intervention, mental health crisis support, in Wyoming, the community mental health centers are the safety net providers. So if a hospital has somebody come into their ER that's in a mental health crisis, our centers work with them very closely to try to make sure we're getting people where they need to go. They would most likely work with our center if it's appropriate, transfer them to crisis stabilization. If they meet the qualifications, which if they don't have an insurance, they don't qualify for Medicaid, et cetera, they most likely would. The community mental health center would provide that service at no charge to that person because the community mental health centers have state contracts to do that.
Alan Ann has a question.
Thank you, Mr. Chairman. Ms. Somerville, with the $2.5 million that has been approved by the legislature so far, isn't that enough to cover this program for the next 2 years?
Mr. Chairman, Representative Hallinan, that is correct. So the request was for 2 years of funding, which the legislature has allocated. That money right now is going through an RFP process with the Department of Health to select a vendor or vendors and move that forward. We do anticipate that would cover 2 years of service. If they finish that RFP process and get that in later this year or early next year, we would anticipate that money would run out, very closely overlap with the new July 1, 2024 biennium. And so I would just say that part of the reason we wanted to be here today in this interim session is to get this in front of the legislators so we could have that discussion about how we would fund that going forward. And we felt like waiting till next year probably wouldn't work very well.
Okay, very good. Representative Ian has a question.
Mr. Chairman, thank you. I just wanted to say what the 911 fee is. It's determined by the municipality and the county, but it can be maximum of 75 cents a month.
Okay, very good. Thank you. Senator James has a question.
Thank you, Mr. Chairman. I was just curious, do you have a grant writer on staff?
Go ahead, Ms. Somerville.
Mr. Chairman, Senator James, I personally do not have a grant writer for WAMSAC, where I'm the only employee for WAMSAC, but my centers do have grant writers on staff. It's pretty par for the course and necessary to be able to run those operations.
Very good. Okay, any other? Representative Sweeney.
Mr. Chairman, you mentioned in some of your comments, trust. And I kind of missed that. So where did that idea come from?
Well, Representative Sweeney, Ms. Somerville talked about if there's any funds left over, they go into a trust fund, like tobacco trust, other trust funds we have. And Wyoming is the expert in setting up trusts to fund things, you know, and sometimes we have these significant surpluses with our energy economy, and we've been able to save for the future with that. So a trust fund of a certain size would kick off enough income to run this in perpetuity, is the idea. That's
So
30 million probably to get started for $1.5 million a year.
So a follow-up to that, are there any ARPA funds that would be in play that would be appropriate for that type of thing?
No, I don't want to get too far out in front of but ARPA funds cannot be used for trust funds, but those that are converted to general funds certainly can.
One last question that probably is for Andy. So just in thought process, if the legislature so chose to expand Medicaid, how would that interplay with all of this?
Ms. Somerville?
Mr. Chairman, Representative Sweeney, that is one of the potential opportunities to provide additional funding into the system through certified community behavioral health centers and potentially the Medicaid office. There is an opportunity that is currently available from CMS to provide a 90% enhanced match for crisis services. We currently do not have the mechanisms in place for that. What I will tell the committee is that we currently have 11 community mental health centers in the state. 5 of them have applied for planning grants to start a very long process of potentially becoming certified community behavioral health centers that would potentially open up eligibility. Now, whether that offer will still be there when they become eligible, or frankly, whether they'll even get the planning grant money is very, very uncertain. I'm happy to report back to the committee when I have more information on that later this month.
And those crisis centers, I mean, that's all generally funded, if I recall.
Mr. Chairman, mostly general funded. There is a mental health and a substance abuse block grant that provides some funding.
Okay, very good. Okay, Representative Jennings.
Thank you, Mr. Chairman, Ms. Somerville. So this is a subject that in probably all of our families, we've had some experience with. On page 3 of your model legislation, this gives me some real pause, because when I think about circumstances in my family or anybody's family, I don't care about serving an at-risk or a specialized population. I find I'm interested in help. And so when it talks about that it's that we're specifying particular types of people, training requirements and policies and things of that nature. Can you speak to that a little bit? Why would we spell that out? Because I don't care who's on the other end. Let's get them some help.
Ms. Somerville, and I think the rest, are we looking at the Wyoming?
You get the very itty bitty one, page
looking at-
3, letter I. Mr. Chairman, Representative Jennings, so it's not something that we're recommending to a Wyoming specific bill. This requirement is a best practice requirement set by the National Suicide Prevention Lifeline. And so they require their call centers to meet these. Our 2 current call centers right now have to meet those requirements. They do that through training. They do that through providing additional access to resources for such as the LGBTQ population. It's a national policy that affects all of the centers that are now the 988 centers. Does that help?
Okay, thank you. You have a follow-up, Representative Jennings?
A little bit, Mr. Chairman. I guess I still don't understand. I don't care who's on the other end of the line. So why would we make that specific?
Okay, go ahead.
Mr. Chairman, Representative Jennings, as a non-clinician for mental health, I would tell you that the discussion certainly has been around providing access to services for people that it does matter. If somebody is in one of these population subsets, American Indians, Alaska Natives, LGBTQ, youth, veterans, if they want those population-specific type services, if they feel more comfortable and they're more willing to engage in those services, if you're a veteran and you can get another veteran on the line or somebody that's trained in that, they might be more likely to pursue services. I would also just very briefly add the 988 service also includes a text component. Wyoming looks to be, or the centers look to be moving forward to joining that text component as well. The number one user of text components is adolescents and young adults by far.
Okay, thank you. I think Representative Yin has a question. You're on the hot seat, Ms. Somerville. We're not letting you off
Mr.
easy.
Chairman, remind me never to come to revenue
like-
again.
Okay, go
Mr.
ahead.
Chairman, Ms. Somerville, are there federal requirements to making sure that the call centers meet those NPSL requirements?
Go ahead, Ms. Somerville.
Mr. Chairman, Representative Yin, without rereading the bill, I don't want to specifically say that it's in the Designation Act. But what I can say for sure is that it's been part of the discussion for quite some time. And there have been many discussions about needing to ensure top quality and top service, evidence-based practices, properly credentialed people to be on the other lines of these. But I will read it cover to cover again to make sure before I answer that question.
Okay, very good. Any other questions? Okay, very nice job. And then your rest of your materials are for our benefit.
Mr. Chairman, they are, and I'm happy to answer any questions for anybody
Sure.
that would like more
And we'll have a
information.
chance to pull you up on round 2 here, I'm sure.
I won't go far. Thank you, Mr.
Okay,
Chairman.
thank you. Any other members of the public here would like to testify on this topic?
Good afternoon, Mr. Chairman, members of the committee. I'm Jeremiah Riemann here on behalf of the County Commissioners Association. First off, this is an incredibly important topic to continue working on. I was just talking to Campbell County Commissioner Rusty Bell yesterday, and at their current rate, they will set a recorded record for suicides this year. So certainly encourage your continued work. Obviously, we're your partners at the local level through the various mental health and substance abuse grants that the counties receive from the Department of Health to offer services. I did want to just provide a little bit of clarity around the 911 fee. There were some questions there. Currently, county commissioners can set that fee anywhere from 25 cents up to 75 cents. All 23 counties have imposed the full 75-cent charge. Just quickly, in terms of statewide collections, counties are taking in just over $7.1 million on an annual basis from that collection. The reason I wanted to get up here is that system is underfunded. Last year, the total cost for the system was just over or just short of $10.4 million. And that's before we go into enhanced 911 systems that will be on us here very soon. So I suspect that the counties and those that are responsible for those systems will be interested if you're looking at raising fees through the phone bills. I'm not discouraging you from doing that. In fact, I've suggested that we might look at the fees for our public safety communication system, or WyoLink, in the state. So again, I'm not discouraging you, but just understand that we have an underfunded system from that same mechanism right now, and that is our 911 system. With that, Mr. Chairman, I'd stand for any questions.
You, Mr. Riemann, any questions? Okay, thanks, sir. Oh, Mr. Co-Chair has a question.
Mr. Chairman, thank you very much. Mr. Riemann, do you know how many public safety answering centers we have in Wyoming?
Mr. Chairman, I don't know that answer off the top of my head, but I can work to get that for you.
I think there's at least one per county, and some counties have more than one.
Right.
And so that's the number one cost of 911 is that it's a hardware and software, but it's a personnel issue too. And so there are 911 systems in the United States that serve as many people as the state of Wyoming in one center. So we have a very inefficient system here. It's largely driven by the local sheriff's departments, to be honest, and it's kind of tended to be housed in the sheriff's department. They're very territorial. But there is no reason to have each county have a PSAP. And I'm just worried about more of these charges on the phone system and where does it go and why is it always phones? I don't understand why we fund PSAPs on the 911 system by a phone charge. And I certainly don't support this kind of a charge on the phones. I mean, it's of general benefit to have the 911. It's not driven by telecommunications. It just happens to be a convenient taxing vehicle, which is overtaxed already, in my opinion. So I appreciate how we could actually do a better job with the funds you have rather than coming back for more funds. Sorry, Mr. Chairman, but.
Thank you. I don't think there's a question on that, but I appreciate that statement.
He's not going to answer.
Yeah. It usually ends with, don't you agree? Okay, we'd love to hear from
He
the
doesn't.
public. Good afternoon. Glad to have you here. Go ahead.
Chair of the Natrona County Suicide. A little closer? Okay, sorry.
Perfect.
Lance Nyberger. I'm the chair of the Natrona County Suicide Prevention Task Force. I've been with the task force for over 15 years, and I just want to let you kind of know what's going on in Casper these days. As Ms. Somerville mentioned earlier, for 3 years running, Wyoming has had the largest per capita suicide rate of the nation. Last year in Natrona County, we had 33 suicides. That is an average of 1 every 11 days. We've got a real problem here. Talking with the chief of police, Keith McFeeters, he said they get close to 600 calls a year just out on ideation. It's taken a lot of people. It's taken a lot of effort to do this. The 988 is an easy system to remember. As Representative Jennings said, just about everybody here has probably been touched by suicide. And it destroys family, it takes a toll. Wyoming is different than many other states in the fact that it is so rural. A lot of other places with huge communities, it's easy to do these things, or maybe easier. But with the rural communities we have here, I think that's part of why Wyoming has such a high suicide rate. Actually, the suicide belt, we are part of what is now called the suicide belt, which basically runs from the Canadian border down to the Mexican border right through the Rocky Mountain states. This is not something I'm proud to say that we're part of, but it is what we're being called these days. Anyway, I just wanted to let you know what we are facing here, and I support the continuation of 988 in whatever manner you deem necessary.
Appreciate you being here and your testimony. Any questions? Representative Baker.
Thank you, Mr. Chairman. So the Transportation Committee is looking at bringing death benefits for the Highway Patrol into parity with other law enforcement. And one of the questions that I asked during that conversation and that was brought up was whether or not suicide should be considered a line of duty death benefit. I know that locally this is an issue that's affected this community, but I would like to see the state kind of move towards that, especially for law enforcement. But what are your feelings about that? Should suicide be considered for law enforcement a line of duty benefit?
Member.
Okay, yes, Representative Baker, I truly believe it does. The toll this takes going to these calls for, be it the city police, the highway patrol, whatever it is, dealing with these emotional situations, dealing with the families in crisis, takes a whole lot of toll, takes a very high toll on these officers. And yes, I do agree that it should be considered.
Probably firemen as well.
Firemen as well, really all first responders. You look into the emergency rooms. A lot of these places are constantly seeing these crisis.
The firemen in
come
this
in.
town, what they see every day. is
Oh,
incredible.
I don't know how they do it. And then they go home and are supposed to act normal and be a family person for the rest of their family. It's hard. It takes a toll on them. And so, yes, I do believe should be a benefit.
Go ahead, Representative
So,
Baker.
Mr. Chairman, you probably have good knowledge about this. I think that's defined through A&I, the death benefits in the line of duty, but I don't know if it's defined through statute, but I think it is through A&I, but I don't know.
Oh, we can find out.
Yeah.
We can find out, certainly. Thanks for bringing that up. Representative Sweeney has,
Thank you, Mr. Chairman. Lance, thanks for being here. So in Natrona County alone, how many first responder suicides did we have last year? You know, I know of 2, one firefighter and one police officer, but
Mr. Nyberger.
Okay, thank you, Mr. Chairman and Representative Sweeney. During a one-year period, going back a few months ago, we had 5 first responders that took their life in Natrona County.
thank you.
Okay. Go ahead, Representative, question.
Thank you, Mr. Chairman. Mr. Nyberg, I have 2 questions. One is on the 3rd page of Ms. Somerville's distribution. There's, in 2014, there's quite a drop in suicides, and it's just gone up from there. Is there any, has that ever been studied why it was low at that time? And then the second question is, and maybe this is for the counties, Mr. Ryman and Mr. Somerville, has 911 and 988 ever been considered to combine those 2 in any way as a savings or an efficiency? Thank you, Mr. Chairman.
Go ahead, Mr. Nyberger.
Okay, thank you, Mr. Chairman and Representative Roscoe. One of the things I've learned about suicide in the 15 years I've worked with it closely is that you can't tell what's going to happen. We are all so unique with our own unique problems that things go crazy and we just can't say. So many times we try and we think that we hit people and start our education and start working with them, trying our prevention efforts early. And that next year we may have the worst record ever. Other years when we don't get out as much, we may have, it just changes so dramatically. And part of this is that we can't really follow up on a lot of these with HIPAA regulations and everything else like that. There's a big limitation to that. I do know that we start speaking and we're being called into grade schools at the 4th grade level to talk to students that are basically 10 years old when they're struggling with problems and talks of suicide within the grade schools. And your second question, I really can't answer. I'm sorry.
Okay. Any other questions, Mr. Nyberger? Okay, appreciate you, and you'll stay through the end to see how we need to call you up again. Appreciate your service.
Okay, thank you.
Mr. Chairman,
Yes, sir, Mr. Co-Chair.
can I interrupt for a housekeeping amendment or a housekeeping issue? Someone has lost a iPhone. And so if there's one laying around that people see, or maybe it was turned in the building, it's actually, don't tell anybody, but it was Richard Garrett. So he's kind of nervous and frantic right now. So if somebody finds it, thank you.
Okay, thank you.
It was an iPad, not an iPhone, even bigger.
Okay, other members of the public, please come forward.
Is this on?
I think it is. Yeah, and you just pull it towards you a little
Hi,
bit.
Mr. Chairman and committee members. Rob Johnston, Executive Director, Wyoming Health Council, and a board member of the Wyoming Lifeline Advisory Committee, which is one of the call centers that we have here in Wyoming. I think as everything has been said, Wyoming is, again, we're ranked #1 in the country with 189 deaths in 2021. We know that 1 in 5 adolescents have a diagnosable mental health condition, and adolescents are also at high risk for suicide. And we see a lot of that in our communities. One of the things that I've enjoyed about being a board member on the Lifeline is that we have experts from around the state who have been involved in getting together and looking at kind of what the issues are, designing what the program that we're going to offer looks like. And those representatives are faith-based, community prevention members, myself and others. And we meet monthly to kind of look at kind of what is going on and address the needs. I wanted to talk a little bit about kind of the story for me with suicide. Is that in my family, I have a cousin who's my age who jumped in front of a truck 20 years ago and died. It was never talked about in the family. It was one of those events that occurred, and there was very little support given to his sister and other family members. We had a case here in Wyoming with the Lifeline a couple of months ago where a woman called the Lifeline actually just wanting help, just wanting to talk to somebody. She was on pain medications and was living with pain that was just incredible. And when she got one of our call center people on the phone, they just talked about kind of what was going on and with her and what her needs were, and were able to make some referrals to resources in the community. But what she was most impressed with was the fact that she was talking to somebody in Wyoming. You know, she wasn't talking to somebody in Atlanta or Pittsburgh or somewhere else. She was talking to somebody who knew her community and knew what the resources were, and also could talk about sometimes if I have a mental health crisis and I live in Sundance and I go to a mental health counselor in that community and I'm driving up in my truck, pretty much everybody in that community is going to know that I'm seeing Susan Jones at that counseling center. And so there's still a lot of stigma in our state related to accessing mental health services and accessing other services that may be required. We need sustainable funding. Grant funding does not cover our costs. We've been lucky with our Lifeline in that we've had grants that have supported that, but we've also relied on the state. I also want to talk about the fact that 988 is prevention, okay? It can be the stopgap that prevents a suicide. It can be that lifeline, truly a lifeline. Both centers answer approximately 400 calls a month. The projections estimate that with the 988 rollout, that call volume could increase, varying between 10 and 15% each year for 5 years. We need to make sure that we have the resources in place to make sure that we can continue what we've started, that we continue to provide these services to those that most need. Thank you.
Any questions for Mr. Johnson? Representative Sweeney.
Thank you, Mr. Chairman. Thanks for being here today, Rob, and for your years of service and work. So some folks believe that these costs can be absorbed by, you know, grants and nonprofits and other work. And we have special resources in Natrona County with some very generous donors. But doesn't there need to be a consistent source, in your opinion, from a governmental agency or some sort of standard funding?
I think the challenge with grant funding is it's great for extra programs that you want to add on, okay? But it doesn't cover the basics oftentimes. And the funding is good for 2 or 3 years, and then you have to reapply all over again. And if you were awarded before, you might not be awarded again. I work with a program that is totally federally funded. We apply for other grants occasionally, but for the most part, we rely on federal funds to provide the services that we give in Wyoming, oftentimes free of charge. That's the challenge we have with some of these kinds of issues. I think, I live in Natrona County. I think, we are resource rich here sometimes, okay? But if I'm living in Grable or I'm living in Converse County even, I may not have all of those resources readily available to me. And I think grant funding can limit what is actually done and provided. So I'm asking for the state to make a commitment to life and a commitment to saving lives. Thank you.
Okay, thank you. Okay, thank you for being here today, your
got it.
testimony. Okay, are there other members of the public? Please come forward. We'd love to hear from you.
Just real quickly, Mr. Chairman, a bluebird landed on my shoulder and made it known that Franz Fuchs from Department of Health and some of the behavioral health folks, division folks, are in the waiting room online. If we have any questions or we need anything from them.
Okay, thank you.
Thank you, Mr. Chairman. My name is Jody Levin. I'm here on behalf of Verizon and Charter. I'm not going to repeat anything that my colleagues have already discussed in recognition of this is an incredibly important topic. It's a serious topic. For Wyoming to rank #1 is nothing that any of us should be proud of, and we should endeavor to not be #1 in this regard. Where my clients disagree with some of the discussion is in the funding source. My clients believe this is something that is the responsibility of government. We fully appreciate the fact that the federal government recognized the importance of this topic, but left it to the states to figure out how to fund it. That's nothing new for Wyoming. It's difficult. As you've heard, a fee on phone bills becomes a very problematic resource, particularly in Wyoming. That overall taxes, fees, surcharges, assessments add upwards to 20% to a phone bill. It becomes very frustrating to customers when they see a price and they get their bill and it's much more than what was advertised. So there's often a lot of questions about why. For whatever reason, and I don't know why, phone bills have often become the kind of de facto revenue collector for the federal government. And so this is something that's gone on for a number of years. There continue to be proposals to use phone bills for tax collection, and it's something that by and large the industry argues against. It's not necessarily accountable. It can be very difficult to be transparent. It puts the carriers in a position of having to be subject to audits. So it's just not, it's not a very clean system. It's also very unpopular with the customer. All that said, this is again, it's an incredibly important topic and it deserves the attention that warrants more conversation. I have not seen the model legislation that Ms. Somerville referenced. Should the committee move forward with legislation, there are some specifics that at least my clients would ask be considered in that bill. Just to give you a snapshot of what's happening nationwide, obviously every state is now dealing with this because the system was mandated to go live July of this year. So it is fully integrated into my client's system. There are 25 states that considered legislation but chose not to impose a fee or an appropriation at this time. Many of them are looking at studying it, trying to figure out exactly how to fund the system. One state, California, I believe legislation is still on the governor's desk. If he may have signed it in recent days, that imposes an 8-cent fee. There are 4 other states that have passed legislation and imposed fees. Nevada has a bill that imposed a fee, but the fee is yet to be determined because they're trying to calculate what that fee needs to be. Then we have Virginia at 12 cents, Colorado at 18 cents, and Washington at 24 cents. So there's no kind of set amount on what states are doing. Some states have looked at, as Wyoming did, at least funding the initial startup with ARPA funds or using ARPA funds in other manners that freed up general funds for them to implement the system. So if the committee is inclined to look at legislation, as I mentioned, there are some specifics that my clients would ask be put into the bill. And one of those is that the fee be technology neutral so that it applies to Senator has a question if you want. I'm glad to stop.
Can she just finish real quick and then go
Sure.
ahead and just finish? You're about done here.
Sure, I
Just real
am,
quick.
Mr. Chairman. So that's just across all forms of a phone bill. So whether that's wireline, wireless, VoIP, prepaid wireless, that fee be consistent across all providers. That the fee be used only for the authorized uses under federal law, so that it's not funding other mechanisms. And this one is important, and this is that similar protections that exist for carriers under 911 also be extended under 988, so that if you're just the carrier who the customer calls on your service, that you aren't then somehow liable. And that's a protection that is afforded under 911, and my clients would ask that that be afforded under 988 as well, if you move forward with implementing a fee on phone bills. The challenge, as you've already heard, is the systems are not, they're not static. Technology is dynamic. So the reason why we're having difficulty paying for 911 is because 911 has changed, and the demands on that have changed, so that it used to be a 25-cent fee, went to a 50-cent fee, now it's a 75-cent fee, and it's not covering the costs. You can expect that something similar will happen here. That's why my clients believe that this is a general fund responsibility of government, and we would encourage you to look to the general fund to pay for this important service.
Very good.
Thank you, Mr.
Senator
Chairman.
James had a question.
Thank you, Mr. Chairman. So I know, well, I think 911 has a different coverage than regular signals, correct? Ms. Levine?
Mr. Chairman, Senator James, I'm not certain I understand your question.
You want to repeat that?
So, Mr. Chairman, so a regular phone signal, when you're making a normal call, has a signal where if you're in an area, you may or may not get a signal. Wyoming's known for limited signal area. So, but if you're dialing 911, that, I think you might have extra range, like you have extra towers. Like if you're dialing 911, you'll get extra towers versus a regular phone call. I don't know if this is correct or not, but is that correct?
Mr. Chairman, Senator James, no. If you are in an area of Wyoming that has limited cell service, if you call 911, you're likely to not be able to connect. The state does have its interoperable communication system for first responders, and that is different. That's WyoLink, and Mr. Riemann can be your expert on that topic. So they have coverage that a customer would not.
Okay, so
And
follow up,
Mr.
Mr.
Chairman,
Chairman.
Go ahead.
just to tag a little bit, so the networks do prioritize 911 calls on their facilities. So if there's congestion, rather than 911 comes to the top of the list. So that might be explaining some of the kind of priority you might see in the field.
So follow up, Mr. Chairman.
Sure. Go ahead.
Thank you, Mr. Chairman. So my question is, with your, the people that you represent, with the number of suicides that we've had in Wyoming, do your customers even cover where we've had the suicides within Wyoming? And so where we've had suicides within Wyoming, do we even have coverage?
Mr. Chairman, Senator James, I'm not privy to where we've had suicides across the state of Wyoming. My carriers are statewide service providers. They don't provide in all corners. So for instance, Charter doesn't provide service in Sweetwater County, but they do in 29 other communities in the state. So I would say by and large, Charter is more of your communities. They don't necessarily provide service out into the rural areas. Verizon is a statewide service provider.
Okay, very good.
Thank you.
Okay. Any other questions? Okay, thank you.
Thank you, Mr. Chairman.
Any other members of the public would like to testify on this, please come forward.
Thank you, Mr. Chairman and members of the committee.
Microphone.
There I am. Thank you, Mr. Chairman and members of the committee. It's such a pleasure to be back with you and to see you here in Casper today. And I really want to say thank you for putting this on your agenda. Normally, conversations like this happen in Chairman Baldwin's committees, not necessarily the Revenue Committee. But that's kind of what I'm doing up here today, because not only is suicide a mental health and a health crisis, it's now become a business crisis. Every day, I hear from my members about Wyoming being #1 in the country for suicide rate. Makes it even harder to attract and retain a workforce. We have a problem here. I thank you so deeply for recognizing and having these conversations. And I can tell by the thoughtful questions from Representative Jennings and Representative Baker that people are thinking about this. Now, I wish I could come before you today and say that I have an answer. And Senator James, your questions have been thoughtful as well. You know, I don't have an answer, but I concur with everything that you just heard from Ms. Levin, that maybe tacking on additional fees on a phone bill is not really that long-term sustainable funding outlet that we might be looking for all the reasons that Ms. Levin stated. I concur with, but even more than that, it's really not equitable, because this is something that affects everybody, not just phone users or technology users. So I just implore that we continue this discussion. Sounds like we're going to be able to have a Band-Aid for the next 2 years, but it's probably going to take us this long to figure out what that answer is. And there's going to be policy choices that need to be made as far as, you know, what to do here. But I also encourage you to think back to your conversations that many of you had in other committees about our crisis with Title 25 and the funding that is directly related to when somebody, you know, finds themselves on the end of the continuum that you saw earlier, and the costs associated when somebody is basically being held in a mental crisis, as opposed to having that ability to have a phone number to reach out to somebody in Wyoming to talk to maybe help them through that moment of need. Folks, these are our friends. These are our neighbors. This is our family that we're losing every single day. It is incumbent upon us as leaders to find a solution here. We have to do something. We just absolutely, and I just want to tag on one last thing, and just a little bit of a personal experience for myself, directly related to what Representative Baker brought up as far as first response and that trauma and crisis of serving in that capacity. I'm a former prosecutor, many of you know that. I still think about those cases that I dealt with as a prosecutor 15 years later. These are things that do not go away. And to be able to afford our first responders some relief and have an outlet, a meaningful outlet, someone here, somebody trained, somebody capable, somebody to help them from going to Evanston, to be able to work them through and deal with that stress of serving their communities, really should be a priority for as we continue on in this discussion. So it's something that we should continue to talk about. Again, I don't come with any solution. I don't think assessing cell phone fees or creating trust funds quite are probably where we need to be. I have not seen the model legislation that was discussed earlier. But I tell you that my members and the business community, this is one of their top priorities, to try to change the narrative, to turn this story around, to at least get Wyoming out of the top 10, like, please, let's work on saving our friends and neighbors. So we stand at the ready as your partner. I want to invite you all to the Governor's Business Forum on November 15th. We're doing a free pre-forum workshop open to the public that will be discussing mental wellness in the workplace. We've got some really phenomenal speakers that, again, will be free to the public for anybody to join in this conversation. And the more we talk about it, that's the only way that we're going to try to figure out what works for Wyoming. So again, I appreciate the time on your agenda, and don't hesitate to call on us in the business community for solutions and ideas. And thank you for your time today. Thank you.
You appreciate any questions?
Mr. Chairman.
Mr. Co-Chair, and then Senator Schuler.
Mr. Chairman, thank you. And Mr. Lancey, I'm very excited to have your support on this. I concur 100%. I'm proud of your business members and the business community of Wyoming for deciding that this is important. And I wonder about the connections to of people. We talked about first responders. I think that's important. I think another connection might be people that don't have health care. That if you have health care issues, there's a slip slide going on that, you don't get treatment for your health care, it leads to other things. And so this committee has talked about Medicaid expansion in the past. A lot of, unfortunately, businesses in Wyoming don't offer health care. A lot of them. That's a shame. So I'm wondering, has your business community thought about this connection and maybe be more supportive or think about trying to get Medicaid expansion for people and maybe help with this problem and help with also this recruiting issue that we have in Wyoming? Is that something you could think about in the connection?
Mr. Lancey?
Thank you, Mr. Chairman. Mr. Co-Chairman, yes, this is something that this conversation is alive and well amongst my membership. And, you're spot on. Healthcare and mental wellness is all part of that larger conversation as far as a thriving business community. I'll, go back to my time as a prosecutor. I used to do all the Title 25 commitments when I was a prosecutor.
Tough.
And it was very tough. And I was really proud of a process that I created. And we did them in the hospital because we felt it was, the judge was kind enough to allow us to do it right bedside with the patient as opposed to putting the stress of putting somebody, in the sheriff's car and handcuffs and back to court. And, so we did it right in the hospital for the ease of the patient. But a lot of the times the people that we were working with were folks that couldn't afford their medication or were off their medication. And had they been able to have that access to their medication, the whole ball of wax could have been prevented. So, again, not an easy discussion. And I agree with you. Unfortunately, many employers are not able to provide health insurance. It's not that they don't want to. It's that it's become such an exponential expense. And, 90% of our business in Wyoming is small business. So, it's not that they don't want to provide those benefits to their employees, but to keep the doors open, hard choices need to be had. So to your point, all options about trying to find ways to keep our employees healthy and job ready and at their best, so they could be at the best for our business customers in Wyoming is an ongoing conversation within my membership, and happy again to be part of any conversations going forward.
Thank you, Mr. Lancey.
very
Thank you,
good.
Mr. Chairman.
Thank you. Any other question? Oh, Senator Schumer.
Thank you, Mr. Chairman. Yeah, that's all right. Close enough. Yeah, you got it. You got it. Thank you, Mr. Chairman. Just a couple of quick questions. It's interesting to me. I don't know still that we're doing enough with prevention. I was thinking about when the gentleman from Natrona County talked about fourth graders, in the district I was in, it was required that we did some type of suicide prevention training, but it was a ninth grade level. So obviously the schools need to do more. But in terms of the businesses, and you mentioned you have a speaker coming to your alliance coming up in November, but what else could businesses be doing? I know you don't have the solutions, but are there things they could be doing, whether they're big or small businesses, to help us out? Not just team building, but maybe something in that area. Do you have any ideas on that?
Mr. Lancey?
Thank you, Mr. Chairman, and thank you, Senator Schuler, for raising that point. We're learning lots in the business community. And what has been so exciting for me to see amongst my membership is that this is now mental wellness and suicide prevention is a priority for training internally. You know, we have so many different large companies, small companies, single member companies that training looks different. But at one of our last meetings in Buffalo, we had a really lengthy discussion about wellness programs beyond, you know, going maybe beyond just gym memberships, but having that ability to create a culture where it's okay to say, I'm not okay. You know, and many of you know, I'm married to a cowboy, you know, and it's really been exciting to see the rodeo community come behind this as well, and using, you know, the metaphor of a pickup man, that everybody sometimes needs a little pickup, you know, like we're making incredible strides. And I just appeal to you as our state's leaders to really continue this conversation and come up with some solutions. But training, partnering with hospitals, working on wellness, offering, you know, maybe a stipend towards some counseling. Those are all things, meditation practices, all different things that our businesses are trying to utilize for the benefit of their employees. Because, you know, as we all know, in Wyoming, our best asset is our people. And we need to protect and nurture and grow. And we want our folks to come to work and know that if they're in a moment of crisis, that they'll be supported instead of chastised or, you know, unsupported. And that's the business community that's really trying to find solutions on how we can keep those numbers down. We don't want, that's the number one we do not want.
Okay, for sure. Okay, thank you for being here.
Thank you, Mr.
Appreciate your
Chairman.
testimony. Any other members of the public would like to testify on this topic? Okay, and I'll just say, oh, do we have online testimony or just online
Yes, Mr. Chairman.
question?
We have
answer?
Lindsay Simoneo from Wyoming Counseling Association.
That'd be wonderful if you'd bring her. Is she the only one, or do we have others that want to testify?
Mr. Chairman, there's a few people who have signed up to testify on this topic, but so I would ask if any of them online would like to testify, please use the raise hand function on Zoom.
Okay, very good. Okay, we can see you. Can you hear us?
I can hear you. Can you hear me?
Yes, yes, loud and clear. Perfect.
Wonderful. Thank you, Mr. Chairman. My name is Lindsay Simoneo. I represent the Wyoming Counseling Association. We are in support of this legislation. So that the committee knows, I do wear a variety of hats, and so we're going to use some of those today. I am a full-time clinician as well, and so I'd like to address some of the clinical questions that happened today. As far as the model legislation picking out at-risk groups, the reason for that is a cultural competency component. Cultural competency is a best practice. It is an evidence-based practice. And the reason for that when it comes to crisis stabilization and intervention is because it increases the probability and the quickness that you are able to de-escalate someone. So whereas, yes, we want to meet all people, we want everyone who needs help to get help. We also want those who are meeting those people's needs to be able to culturally competently answer a veteran who may have experienced trauma and he is going through a moment that's associated with that trauma and things of that nature. So that is why that is in that legislation, is because it is clinically best practice. As far as why have we never combined 988 and 911, the issue really is congestion. When somebody is in a mental health crisis, it is not uncommon for them to be on the phone for over an hour. With the rural nature and the staffing that we have with dispatch, it would be irresponsible for our 911 dispatch to be on the phone with someone for an hour when there are other health crises coming in, whether it's somebody who is needing law enforcement because they've been mugged, or God forbid, a stroke that needs immediate health care. So by giving mental health its own lifeline, by giving mental health its own dispatch, we are keeping 911 open for those other needs that we are seeing within our community. As far as some of the other concerns today, we do agree that the fee should be tech neutral. We recognize that technology is always changing. We recognize that what we are using today, we may not be using 5 years from now, 3 years from now. And so we think that the fee being tech neutral would be appropriate. We do recognize that, nobody likes to see their bill go up. Nobody likes to see the taxes and how that breaks down. However, if I need an ambulance for my child, I am happy I paid that fee. And if I need a crisis counselor for my adolescent, I will be happy that I paid that fee for my own child or the child of my neighbor. I also want to touch on the point that was made that systems are not static. We agree. Systems are not static, and that is actually why we have proposed the trust fund. By having that trust fund gaining interest, then we are able to have that additional interest and that additional funds as the system changes, as there are more needs, as technology changes over time. And so that is by design, and it is because of the lack of static that these systems tend to have. We're trying to avoid on this front end with the legislation some of the concerns that we've seen with 911. Finally, I really just would like for revenue to understand that this is not the first time we have had an opportunity like this or come up with a way to create consistent funding for either crisis stabilization or mental health and substance abuse centers. A few years back, we considered taxing beer with the hopes of funding not just our suicide use or our substance use programs, but also substance prevention programs as well. And similar, there were concerns, as we've heard today, that not everybody drinks, not everybody uses beer. This is a general utility. This is a general usage for the public. And though we do know that not everybody is on a phone, what we also know is generationally that is increasing exponentially. As we look at Gen Z and the generation that my children is in, which some are calling Generation Alpha, they may not have toilet paper. They have a cell phone, and that is being made a priority across the board. So as we see them age into adulthood, we're going to see more of that technology, and we are seeing it become more general. And with that, I do believe I stand for questions.
Okay, thank you. Members, any questions? Appreciate you joining us today and your testimony. Thank you.
Absolutely.
Thank
Thank
you
you,
very
Mr.
much.
Chairman.
Do we have anyone else online? None? Okay, anyone else on this topic? Okay, members, what's your pleasure on directions to staff? We don't have a bill to work on. I think, what's that?
Let's have one come next time.
I think we'll just, if we could get a bill draft, I think here's what I guess this is less than 0.1% of our annual budget. I mean, we're going to pay for this one way or another, and we're going to have a sizable surplus. I think you'll see the LSRA go to over 2 billion for the first time. And I think we're going to find a way to pay for this permanently. I just think, so I guess in this bill draft, I would like to just ask when the committees, we have some sample bill drafts, leave it to our experts at LSO, and then I would like you to have some kind of trust component in there that maybe we can start filling that up. We can do this 1.5 million for a year or two, whatever it takes if we need to, and maybe we'll have a chance to fill this up. I don't think we need to put a tax in it. That's my thought, committee members, so anyway, that's not really a motion, but that's my thoughts going forward on this deal to move us forward. Any other thoughts?
Trying to get my,
Mr. Representative Hallinan and then Mr. Co-Chair.
Thank you, Mr. Chairman. I really think that we have a 2-year period to see how this program works out. It's a new program. We don't know how good it's going to be. We don't know how many suicides are going to be prevented. I think we need to see some experience with this before we put money into it. So we have 2 years here that this program can be in place. And that is an ideal way to see if it's a program that we want to fund. And at the end of that time, or somewhere maybe sometime next year, we can address this with the good ideas that we have about putting money into a trust fund or funding it out of the phone bills or whatever. But I don't think that we need to do anything at this time.
Okay.
Thank you, Mr.
Very
Chairman.
good, thank you. Mr. Co-Chair.
Mr. Chairman, I think I can concur with your suggestion. We got some money right now. Let's use it wisely. Let's get this thing going. And I like the trust fund idea. That may not entirely work out, but that would be how I'd like to proceed.
Members, any other thoughts, any other ideas? Representative Sweeney?
Thank you, Mr. Chairman. So I would agree also that utilizing some of these model pieces, working with stakeholders, if LSO could do that, it doesn't mean that it may or may not be ready for this next session, but I believe I owe it to my constituents. This is a real crisis that Wyoming is facing and has been facing. And it really hit home going to one funeral up at the event center this past year with one of our beloved police officers. And I just think we have to move forward on this and at least have a draft piece of legislation to look at.
Okay, any other members? Senator James.
Thank you, Mr. Chairman. So we've been funding this end of it for many, many years. And we need to start looking at the other end of mental health. We need to start looking at why people are having these issues, why they're going to drugs, why they're going to alcohol, why they're doing what they're doing, why kids are attempting suicide. If we start doing that, we can start getting rid of all these other programs. Because if we start figuring out the why, we can resolve a lot of these issues. But there's just so much money in all these other programs and all these other things that we're doing that we just keep going there. So we need to start figuring out the why. We need to start looking at that end of it. And so that's what we need to start doing. That's where we need to start focusing.
Okay, other members? Representative Yen,
Mr. Chairman, can I make a motion?
please make a motion.
Mr. Chairman, I make a motion that we have a bill drafted for our next meeting that uses the structure of the revised model legislation that Ms. Somerville gave us, but with a funded trust fund as the funding mechanism instead of a phone fee. And that we also incorporate any other community stakeholder input on the drafting of that before it comes to our next
Seconded
meeting.
by Senator Schuler. Okay, any other discussion? Okay, all those in favor of the motion, say aye.
Aye.
Oppose? Okay, that's been adopted. We'll have that bill draft be on our agenda for the next meeting. Okay, thank you all for coming. Really appreciate you and all your years of service. And yeah, just really appreciate you. We'll keep working on this and keep taking steps forward. So thank you so much. Okay, our next item on our agenda, and we've covered in our very first meeting in Lander, and now we're going to hopefully get to a little conclusion, is tobacco taxes. We have a bill draft, and I think if Mr. Anderson would walk us through that bill draft, then we'll take public comment and work that bill, and then we will be finished for the day and come back and do it all over again tomorrow. Okay?
Just the efficient chairmanship that I'm feeling here.
Well, after
Mr. Chairman, Josh Anderson, LSO. Yeah, as you mentioned back at our April meeting, in Lander. We talked about tobacco taxes in general, and the committee requested 2 bills. Out of that, this first bill related to taxation of cigars, 23 LSO 62. The request was kind of to base this, it kind of does 2 things. In general, it provides a tax cap on cigars, which is similar to North Carolina. Also revised the timing of payment of premium cigar taxes to be due on the sale of the tax, similar to cigarettes, rather than every month as other tobacco taxes are paid. So just I'll walk you quickly through the bill, Mr. Chairman. First thing, on page 2, this bill provides a definition of premium cigar. As that was kind of the request for the payment piece to be on premium cigars. This definition was pulled from the FDA. That was really the only definition I could find that defined what a premium cigar is. So you can see there, it's wrapped in whole tobacco leaf, handmade or hand-rolled, has no filter or non-tobacco tip, does not include any characterizing flavor other than tobacco, contains only tobacco, water, and vegetable gum, and weighs at least 6 pounds per 1,000 units. Over to page 3, Mr. Chairman, you can see here is the cap on cigars, and this is the rate that was used in under the North Carolina law, which is a 30-cent cap per cigar. I'd note there that that is not limited to premium cigars, but would be for any cigar. And that same change is made in retail consumers on the bottom of page 3. Over to page 4, these are changes related to the returns and reports due on, again, just premium cigars in an effort to change when that tax would be paid. And that's really done on page 5, where this tax is paid upon the sale of each cigarette and premium cigar. And then and then the rest of those are just conforming changes, Mr. Chairman. I'd take any questions on that one.
Questions, Mr. Anderson? Appreciate your work on this. It's good bill. Knocked it out. Okay, Representative Sweeney has a question.
Thank you, Mr. Chairman. So in utilizing other state legislation, potentially, is there a differentiation between premium and large in any of the definitions with federal statutes or?
Mr. Anderson.
Mr. Chairman, Representative Sweeney, not that I saw. Most of the other states that have done this type of a cap, they just had it be on just cigars. But we did have that conversation at the last meeting of the idea of premium cigars, and there was this FDA definition of that.
Okay, very good. Any questions? Any further? Senator James has a question.
Thank you, Mr. Chairman. Josh, are all tobacco products taxed at the same rate?
Mr. Anderson.
Mr. Chairman, Senator James, all are currently taxed at the same rate except for cigarettes and moist snuff have different tax rates. And then the other ones have this, the 20% or 10% rate, as you see here.
Okay, thank you. Okay, any further questions? Okay, we're going to open this up then to public comment. I know we've, for sure, are there any folks online that would like to comment? Okay, and Senator Pappas has a quick.
Yeah.
Go ahead.
Just my, and I think I mentioned this last time. My concern was with the weight of the cigar, whether we even need that in there. To me, if you know, if any a premium cigar would be a whole tobacco encased product that's handmade or hand rolled. And I don't think we ought to limit the size. I think, you know, a small short story is to me a premium cigar. So I want
I like
anybody.
this guy.
This is getting interesting.
I want anybody to comment on whether we should just delete the weight.
Well, first, can you introduce yourself, and then we'd love to hear from you.
Thank you, Mr. Chairman. I'm Donovan Short. I'm the owner of Casper Cigar Company here in town. We're a premium cigar retailer and pipe tobacco retailer.
Okay, now you heard Senator Pappas. I think he's kind of directing that.
I did, and I agree wholeheartedly. The bill as written is no doubt a positive development for the very small handful of Wyoming's premium tobacconists that are impacted, and also our Wyoming consumers. The only concern is that, to your point, Senator Pappas, in an effort to define, I think we're going to get into some nuances that are going to make things complicated, not only for retailers, also probably for our folks at the DOR, and I think there's going to create some confusion among consumers as well. When you're looking at this definition, which by the way was pulled from an FDA, as the gentleman mentioned, there are several discussions happening right now with tobacco, premium cigars, many other things going at the FDA, not in relation to taxes. This language is very accurate until you get down to like section D in the exclusions,
Is that section D?
or
as
actually
in
item D in the
on line
page 2.
13?
Page 2 with definitions here. You know, handmade, hand rolled.
I just couldn't tell if you said B or D.
D is in dog, yes.
Okay, thank you.
So when you begin to talk about characterizing flavors as they apply to premium cigars, for example, we have things that are, you know, considered premium cigars. They're long filler, they're handmade, they're hand rolled. There might be two identical cigars from brand, manufacturer, price, everything qualify, you know, to factor into this bill. One might be sweet tipped and the other might not. And the fact that one, as this is written, it would create one having to be taxed at the full 20% as current, and one that would be restricted by the cap. So you'd have 30 cents on one, and we're talking dollars on the other, you know, in that case. So I think consumers would be confused by that. I think it would create a lot of reporting headaches and things from, you know, the small local retailers. You're looking at 50% of my staff right here, so it's not like we have a lot of folks to go around in that regard. And also, I think it would create a few headaches for the DOR in that respect too.
Hey, very good. That answer you.
It does, because there are like an acid cigar, right? That's hand rolled, isn't it?
Correct.
So
Hand-rolled premium cigar, but
why
is
would-
infused and flavored.
why would that be any different than
Correct.
any other premium cigar?
Absolutely.
So I think I agree with you. Maybe we should delete D and F.
Maybe you guys should adjourn to
How
the
about,
store. and
yeah, that sounds like you might.
D, E, and F actually in
E
that
and
section.
F,
yeah.
yeah, are kind of the, okay. Any other discussion? Any questions? Representative Deanne has a question.
Mr. Chairman, thank you. How would you qualify consumers of premium cigars versus consumers of other cigars? Are there any demographic differences that you would note?
There are.
Go ahead, Mr.
Chairman and Representative Yin, they tend to look a little like me. They're typically older males in most cases. We are exclusively a 21 and up shop because we retail nothing but premium cigars and pipe tobacco. A lot of the items that factor into the demographic discussion tend to be non-premiums, tend to be sold in C-store or gas station type environments. And one more point that goes along with that as well, the nature of the cap itself kind of provides, to those of us in the industry, provides the segregation between premium and non-premium just as a function of price. So, the stuff you're going to see in a C-store or gas station, you're talking about 2 for 99 cent type products as opposed to $10, $12, $15 and up, premium cigars.
Okay. Any other questions? Representative Gray.
Mr. Short, what is your preference on what we do with the definition? Just delete everything after D, or is there something?
I would say definition is not really a factor in this conversation. I mean, there are many conversations going on about premium cigars and other venues that definition seeks to enter in. The nature of the cap, as I mentioned, is pretty much going to make that definition for yourself. You know, premium cigars are at a price point that typically would be capped, and non-premiums are typically at a price point that in many cases would just be paying their 20% as normal.
Okay, Representative Sweeney, question.
Thank you, Mr. Chairman. So on a premium versus large, is there big difference? I mean, is there, you only sell premium versus a large cigar, or are they one and the same according to, Department of Revenue?
Representative Sweeney, for Department of Revenue purposes, premium cigar is regardless of size. As Senator Pappas pointed out, there are very small cigars, that are considered ultra-premium cigars. By extension, there are also, very large cigars that are not considered premium cigars. It's mainly a function of the method of creation, the quality of tobaccos used, the price point of the item. That's where the distinctions tend to come in more so than weight and some of these defining characteristics here. Does that make sense?
Okay, very good.
Follow up.
Yeah, sure. Go ahead.
So by these definitions, Department of Revenue would automatically understand those differences?
Correct. We are assessed 20% basically on wholesale purchases within a quarter of any item. And again, in my case, we're just doing premium cigars and pipe tobaccos, so all of those fall in. Many of the other non-premium cigars also are subject to that same 20% OTP. As the gentleman suggested, I believe roll your own. We don't sell that, but I think it is still at the same rate, but requires different filing for those that make their own cigarettes. Pipe tobaccos fall into the 20%. I mean, there's not a lot that fall outside other than the moist snuff that he mentioned earlier.
Yeah.
Okay. Any other questions? Mr. Co-Chair.
Mr. Chairman, thank you very much. Sir, kind of getting back to, people are spending a lot of money on these cigars. Relatively expensive, I would expect. And so they seem to illustrate a little bit of price insensitivity. So why not just leave it at 20% and put the money to good use?
At 20%, sorry, Mr. Chairman, and Mr. Co-Chairman, the disparity that I think impacts the consumers negatively here is that there are many options, many places outside of Wyoming, that you can get your premium cigars, and many do. In fact, I would wager the mass majority of cigars that are sold in Wyoming are not sold in Wyoming. They're sold in from outside Wyoming. And so keep in mind, those are retailers that are not subject, they're not conducting that business in state in terms of wholesale. So they're not paying that 20% and it doesn't factor into their pricing model. So when you add that along with the scale of some of these companies, some of these massive retailers, it's a bit of a burden not only on Wyoming consumers, but it really makes the playing field unlevel for the small businesses in Wyoming too that sell the same product.
And Mr. Chairman, follow up. So is that competition from people that order online and have their cigars shipped to them? Is that the way the competition works? Or?
There is quite a bit of competition from that, and I would wager that is the absolute largest product category or retailer category in Wyoming are the out-of-state retailers.
I see. Would Senator Pappas agree with that?
Oh, no. Well, my question is, thinking about the online sales, are we collecting the 20% from those folks?
No, not to my knowledge.
That's something we need to fix.
Yeah, that's something we got to find out. Should be, if make a level playing field, obviously.
You got a DOR guy back there.
Okay. Do you have an answer to that question? Department of Revenue, can you come on up and introduce yourself and
smoke them if you got them.
Mr. Chairman, while he's approaching.
Sure. Representative Sweeney.
What's an average cigar like this? I mean, it's totally out of my realm.
Average cost?
Yeah.
Yes.
Of a cigar or retail?
Yeah.
Typically 10 to 15 price point is where it would fall.
Okay.
Wow. Okay.
That's a function of wholesale cost, tax, and everything else.
Hey, let's get the answer to this online tax question. Go ahead and introduce yourself.
Mr. Chairman, Mr. Co-Chairman, members of the committee, my name is Brett Fanning, the Excise Tax Administrator, Wyoming Department of Revenue. So, Mr. Chairman, in reference to that question, I actually was discussing it with our Attorney General's office this morning regarding it, because on the sales tax side, okay, there's economic thresholds that this legislature has put into effect. Now, in our tobacco tax statutes, the definition of a wholesaler says that if you make any sale of a tobacco product into the state of Wyoming, you would be required to license with us. That's one sale. Okay, now, members of the committee, Mr. Chairman, we do our best to try and track down all of these folks. We most certainly do, but we also acknowledge that we do not have all of them licensed with us.
Okay, so then the licensed ones, I think we're to continue this, pay the 20%.
Mr. Chairman, yes, that is correct. If they are licensed with us, then we have we have confidence statutorily that they're going to report the tax to us.
Okay, Mr. Co-Chair.
Mr. Chairman, I just want to clear something up. Mr. Fanning, you used the term wholesale. So direct to the consumer purchase online. I think we just found the famous iPad of Mr. Garrett, hooray. Is that a retail or a wholesale? I mean, does it escape taxation based on that? Do you see my point? I think of wholesale going to a retailer in Wyoming and then resold.
Exactly.
But you use the term wholesale. So I'm just throwing it back at you.
Go ahead.
Mr. Chairman, Mr. Co-Chairman, yes, I intentionally use that term because that is how it is referenced in our tobacco tax statutes. So a wholesaler in our tobacco tax statutes says that if you're selling tobacco product or nicotine products into the state of Wyoming, there is a requirement to license with us. And so if you are selling tobacco products in our statutes currently, that is a wholesaler, okay? And in our tobacco tax statutes, a wholesaler is someone who sells for retail sale or wholesale.
So clear.
Very good.
So,
Okay.
Mr. Chairman,
Thank you. Appreciate it.
so
Mr. Pabst.
just an
Senator Pabst.
example, one of the largest online is Thompson Cigar, right? Correct? Are they paying 20% right now?
Go ahead.
Do you know if they're in your?
Mr. Chairman, Senator Pappas, I can certainly do that research for you. If they meet our economic thresholds sales tax wise, and then they are also selling tobacco into our state, they should be licensed with us. So I will need to do some additional research for you and get back.
Okay. Any comments, Mr. Short, on those?
If I may, just to follow up, I think, Mr. Chairman, the distinction is probably, and again, I would look forward to hearing about that as well, once it was investigated. We have what we call wholesalers that we deal with that collect OTP taxes and submit OTP taxes on our behalf. So there's a Phillips and King, for example, that's a large wholesaler that sells into retailers in the state. They have an agreement where they, place the tax onto our order as ordered, and then they submit through the licensing with the state. I'm not aware of any direct-to-consumer retailers that do the same. I think it's pretty much a sales tax only if they're licensed, and there's a few, I'm sure, that aren't. So that's pretty much the competitive landscape.
Okay. Mr. Representative Yanez, question.
Do you respond to, thank you, Mr. Chairman, do you respond to complaints if other retailers or consumers find online retailers that aren't following or aren't licensed or permitted in charging sales tax?
Go ahead.
Mr. Chairman, Representative Yin, the answer to that question is most certainly yes. If we do receive some sort of complaint, remember, so my division administers the tobacco tax statutes. And so if we find someone who is not in compliance with our statutes, yes, we will reach out to them and get them licensed as soon as possible.
Okay, go ahead, Senator Pappas.
Yeah, can someone tell me our thresholds for taxing online, do they change via industry? In other words, if you're taxing an Amazon, for instance, I mean, they probably sell to everybody in the state, right? But cigars are going to be a very small threshold of people in the state that would be buying this product, right? comparatively. So does the threshold change? Can someone tell me, does the threshold change depending on the industry?
Go ahead.
Mr. Chairman, Senator Pappas, I do have the answer to that question. The answer is no. Our economic thresholds are the same regardless of industry. So right now, it is 100,000 annual sales into the state of Wyoming and or 200 separate transactions. And so it's important for not just members of the committee, but the public to understand that that 200 transactions also plays into a part of this whole remote seller and marketplace facilitator language that we have in our statutes.
Very good. Good. Okay, Representative Sweeney.
Thank you, Mr. Chairman. So currently, how let's say you have a $15 retail cigar. How is that currently today taxed?
Who would like to answer that? Mr. Short, you want to?
Sure, there is a 20% tax applied to the wholesale purchase price for us of that cigar. If it's a $10 cigar, for example, wholesale, you're collecting $2 worth of tax on that, and that factors into the final price that you see on the shelf. We also collect a 5% here in Natrona County sales tax rate that we submit monthly to the DOR as well on the full sales price. And that's effectively all the tax that's rolled up in a cigar.
But the key, I think, that we heard from you back in the spring in Lander, you pay that 20% and you might not sell it for a while. That was the issue of remitting that once the cigar was smoked in your shop or whatever, once you sold it. Is that correct? I mean, that's in this bill too.
Mr. Chairman, that's quite correct. Again, sales tax is easy for us. It's applied to the end of the purchase and we collect it and submit it monthly, with every transaction. For example, I have a September 24th event coming up at my shop with a manufacturer who's flying in from Honduras. We're making several $1,000s worth of purchases, to stock up for that event, and the tax is due 6 days later. So, you're not going to sell through that inventory in time. An average cigar takes months to turn, and there are some cases where things are, a year and a half or more, and a lot of times we end up closing those out at a discount or a loss. And again, we're still responsible for the 20% tax, even though we went backwards on the item.
So for sure, we've got that fixed, I think, in this bill. It's later in the bill, but, okay, Mr. Co-Chair.
Mr. Chairman, and just to be clear, that is the part about where it says timeline in the bill, and it says it's on page 5, line 18, I think. That's where we catch it upon the retail sale, is that right? I might look to is it okay to give Mr. Fanning on that?
Yeah, absolutely.
Mr. Chairman, Mr. Co-Chairman, yes, that is correct. And I do want to take some time to explain this a little bit as well. So in our tobacco tax statutes, most of that tax is when it is purchased. And that is completely different than the other taxes that we truly administer. And so previously I was a former auditor. And so when I was teaching folks how to audit for tobacco taxes, I essentially broke it down into 3 buckets. And now it's really 4 buckets, okay? The first bucket is kind of this vapor material and e-cigarettes. And so that's taxed at the wholesale purchase price as well. Okay, throw that aside for right now. Okay, the next tax that we administer is cigarette tax. Okay, and that's at 60 cents on a pack currently. Okay, throw that aside right now. Okay, the other tax that we come up to is moist snuff. And this is actually 60 cents on an ounce. And so there was previous testimony. There is some weight in our moist snuff statutes on how it's taxed. Okay, so when you buy a can of Copenhagen, that's going to be taxed per ounce. Okay, and so throw that aside now. Anything that is not in those first 3 categories that I discussed comes into this other tobacco product side, kind of this 20% that we've been referencing. And so right now, 20% of that wholesale purchase price, 20% of per ounce on moist snuff, 60 cents, sorry, let me start that back over again. 20% on other tobacco products, okay? And then you've got the 60 cents per ounce on moist snuff, and then you've got tobacco tax, the cigarette portion of it, and then you've got the electronic cigarette portion of it as well. So all of these 4 buckets that I'm talking about are based on that purchase price, okay, not the retail sales price.
So,
Go ahead.
the terms get a little confusing, because when you say purchase price, I'm thinking retail, and so wholesale purchase price and not on the retail. So this piece in, where we add on line 21, page 5, and premium cigars, that's what makes it be on the retail sale to the end consumer. And that's what you like and good. And it seems to me that we could develop this bill if, I'm not all persuaded about the 30 cents per cigar, to be honest. I don't see why the 20% isn't good, but I do see this point with, and we could take this bill and make it into being taxed when the cigar is sold to the end consumer, and not deal with the other tax part. Maybe you ought to respond to that, because you don't like that, but we could do that.
Okay, any response on that? You're nodding affirmative, Mr. Short?
Mr. Chairman, Mr. Co-Chairman, on the subject of the cap itself, again, I would also just kind of refer back to, it serves as one point to kind of make that distinguishing line, between premium and non-premium. I think the math works out pretty well to kind of self-segregate in that regard. Also, back to the, leveling the playing field, for small business discussion. Most cigars that are sold online by the large retailers are sold at MSRP or below, because they're all based out of states that don't carry tobacco taxes in most cases, or it's pennies a stick. In a lot of those cases. So to allow us a little bit of parity with, competing against the online folks, the 20% is a huge factor in terms of shelf price for us, so.
Follow up?
Go ahead, Mr. Co-Chair.
But if we could close the online loophole, which I think if they have more than 200 sales, they would owe the tax in Wyoming. They'd have to factor that in. They'd be like, now when you buy from any major catalog place, they ask what state you are and they assess that tax. Could we go down that road and close that loophole, solve that problem for you of the competition with the online? Totally get it. But I'm guessing people, I know people when they travel, they buy cigars and bring them home. We can't do anything about that. But that's not where your big competition is, I bet. And why would we have to give, why couldn't we keep it at 20% if we could do a better job of getting the other guys and maintain the revenue for Wyoming? And both of you, it's a question for both.
Either one of you gentlemen like to, I guess my thing, and I remember we were one of the last states to go to online sales tax. I mean, it was, we were one of the last states and we finally did, but I think this 200 transaction threshold also, I mean, is that a problem to lower that for like tobacco, for make it every transaction? Is that a nightmare for your division?
Mr. Chairman, the answer to that would be no. Where that 200 transactions or the $100,000 cap came from is really generally what most states adopted when South Dakota versus Wayfair came out. Now, each state has slightly different thresholds and they're not all the same. But the reason for that cap, based on my understanding, the 200 transactions, was if you had the mom and pop quilt owner or the mom and pop jewelry maker who was selling into another state, he or she is likely not going to make 200 separate transactions. This was really for that middle, that mid-size, that regional player who is selling into those states.
Okay. Any other questions, thoughts?
Mr. Chairman.
Representative Sweeney.
So I have no idea, nor probably I should, what the wholesale on a premium cigar, but let's hypothetically say on a $10 retail, maybe your cost might have been $5.
Representative Sweeney, if we're speaking, Mr. Chairman, in terms of just MSRP, yes, but that 20% OTP also factors into our final shelf price as well. But yes, you're correct that wholesale is half of the cigar in most cases, half of the
Okay.
retail price.
So on $5 wholesale, a 20% tax is 10 cents?
No, it's $1. It moves from a $10 MSRP product to an $11 MSRP product.
Toronto County School System.
Okay. And then when you sell the product in your store, do we also collect sales tax on the product at that point also?
Correct, Representative Sweeney. You have a 5% in here in Toronto County, for example, sales tax applied on top of that $11 in that example.
Okay, thank you.
Go ahead, you have something more?
Mr. Chairman, there are 2 points that I would like to make, and the one is with regard administratively. Again, the Department of Revenue doesn't have any position on this bill. The point I have with premium cigar, and so that is a definition that is in this bill draft. It's also interesting to note that our statutes, our tobacco tax statutes, don't have a definition of cigar. And so it's important to note that when we're talking about the 20%, right, that's everything that's pretty much not a cigarette or not moist snuff. Everything else goes into that category. And so kind of separating this out administratively is something that my division would, my staff is absolutely amazing. But that is something that is going to be not necessarily an issue. We will administer it how the legislature wants us, but it is something to consider. It also plays into the tax rate, and it goes to Representative Sweeney's question, is that, okay, you have this 20% tax on the wholesale price, and then for this certain segment of OTP, that 20% has a different tax rate. And again, we will do whatever the legislature wants. These are just areas that I need to point out administratively.
Okay. Any other thoughts? Okay, Representative Yen.
Mr. Fanning, thank you, Mr. Chairman. Do you think that that would require you to have more staff to be able to navigate another separate tax rate?
Fanning.
Mr. Chairman, Representative Yen, the answer to that question, I can't answer it. We have a couple hundred tobacco wholesalers that are licensed with the Department of Revenue. And so the bulk of our operations is in our other tax types. But yes, it will require additional time for programming to create additional form. We do have one region that really focuses on our tobacco taxes. And so already being stretched thin, I understand the point of your question. And yes, we can always use all the manpower, womanpower that we could, but it is additional time that I need to dedicate my staff to separating out this premium cigar.
Okay. Representative Sweeney.
Thank you, Mr. Chairman. So if I understood properly, though, we don't define cigar.
Go ahead.
Mr. Chairman, Representative Sweeney, that is correct. The term cigar is not in our statutes. That being said, the Department of Revenue has it in our rules and regulations because we didn't have it in statute. And based on what LSO staff was saying, yes, we do use a lot of the Federation of Tax Administrators definition. That also is the same with cigarette. Okay, that is also one, is the name of our statute, but it's very difficult to find the definition of that in our statutes as well. So the answer to your question is yes, it is not defined in statute. It is defined in the Department of Revenue rules and regulations.
Okay. Any other questions, comments? Okay, anything else, gentlemen? Anyone here in the audience would like to testify? Please come forward. Yeah, we have a couple. Go ahead. We have more seats. Come on up. Both of you guys can come up. That'd be great. Then we can. Is there anyone online that's signed up to testify on this topic? Okay, we'll do these two ladies and then we'll move to online and then come back in the room. Okay. Go ahead, you go first.
Mr. Chairman, members of the committee, my name is Laura Lewis, and I'm here on behalf of the Cigar Association of America. And my comments will be brief. We stand in support of the cigar tax as written in this bill. As far as the collection and the interval or the time in which it's collected, we're neutral on that. I do want to comment as to Co-Chairman Case's thoughts on the cap. I think there is a real value to the cap and the ad valorem nature in which the tax is imposed, especially in times like inflation that we're seeing right now. When you have just a percentage of the wholesale price and you have a price-sensitive product, certainly it can discourage consumers from that higher price point just because it has a higher tax burden. I think the cap is a good method toward achieving more of that unit rate and buffering a little bit the burden to the taxpayer in times of inflation. I think you can also kind of consider fuel tax. We have different levels of fuel, regular, mid-grade, premium, and we don't necessarily capture a higher rate or a higher amount off of a premium that is otherwise of equal quantity. So with that, I'd stand.
Mr. Chairman.
Hey, Mr. Co-Chair.
Mr. Chairman, Ms. Lewis, is this the first time that you've ever testified in a building that's named for your grandmother?
Mr. Chair and Mr. Co-Chairman, yes, it is. It's a great honor.
Congratulations.
Thank
That's
you.
very cool. Thank you.
Thank you.
Nice testimony.
Okay, very good. Now, okay, any questions for Ms. Lewis? Representative Yin has a question.
Mr. Chairman, thank you, Ms. Lewis. So we talk about winners and losers here, and I do worry, does putting a cap on premium cigars kind of put our finger on the scale specifically for premium cigars, especially benefiting that specific demographic that premium cigars sell to? So I guess my question is, why should we make the policy decision to cap this instead of just letting the market do what it should with regards to either selling premium cigars or less premium cigars?
Mr. Chairman, Representative Yin, I actually agree with you, and we would not support a cap that only applied to premium cigars. The way this bill is written, it is my understanding that the definition premium cigar only applies to the compliance and the capture of the tax and when it's due. With respect to the cap, it applies to all cigars, and that is something that is very important to us for all those reasons you mentioned.
Okay, I think that raised everybody's hair on their head a little bit and kind of, huh? So go ahead, Mr. Sweeney. I think you were all thinking the same thing.
So, thank you, Mr. Chairman. Is there a better definition, I guess, going to large, a large cigar versus premium? I think we're trying to get, the only thing I know is a Swisher Sweet. So, I mean, that's, but, which I know is not a premium or a large, so.
Mr. Chairman, Representative Sweeney, again, and it's my understanding from the reading of the bill draft. The premium cigar definition only applies as to when the tax payment is due from the retailer. And we aren't weighing in on that. That's a policy decision for you all. If I interpreted correctly Mr. Donovan's comments, I think he even mentioned, he's not so sure if the definition is critical, that, it can be confusing to consumers. The Cigar Association certainly would suggest that you keep this as simple as possible. That's why we are supportive when it comes to applying the cap in the bill. We're supportive and appreciate that it only references cigars across the board and doesn't apply it only to premium. We would find that confusing and complicated for consumers, possibly for retailers as well. So as far as that premium definition, I don't know how critical it is to the bill. We certainly don't want it to apply to the cap, and it's my understanding as it currently stands, it does not.
Okay, Senator Pappas.
Just for Representative Sweeney's information, the way I read it is there is no large size is not involved here, other than what we show by weight, and I think we ought to take that out completely. Really, the key thing is A and B. It's wrapped in a whole tobacco leaf itself, and it's hand rolled. It's not machine made. To me, that's a premium cigar.
Okay. Okay, any other questions for Ms. Lewis? Okay, gonna move, thank you. Gonna move, please introduce yourself.
Good afternoon, Chairman and members of the committee. For the record, my name is Kristen Page Nye, and I'm the new Government Relations Director for the American Cancer Society Cancer Action Network. We're the advocacy affiliate for the American Cancer Society, and we support evidence-based policy and legislative solutions designed to eliminate cancer as a major health problem. And we're here today to oppose this bill draft, and really, I think a lot of important questions have come up here. Our perspective is from the public health perspective, right? And then also there will be winners and losers created by this, in our opinion. I think we forget that cigars are harmful to health, and that there was a lot of thought and effort put into how we define other tobacco products. Every year, there's different products that are created on the market, and by having a taxation for cigarettes and other tobacco products, it allows us to have that be more administratively simple, and also look at how we can be equitable, on how we tax all of those products, so we're not unintentionally rolling people from one product to another. Does that, and that's what we're very concerned about. This particular bill puts an artificial cap on on all cigars, as we've heard. Mr. Johnson was really clear in stating that. And just in Googling premium cigars, while I was sitting in the back, range from $2 to $50, and I'm sure there's even more expensive premium cigars. But on a $2 cigar, that would be 50 cents at the current taxation rate of 20%. And so for every cigar that's out there, you're likely not going to get that 20% threshold. And I know, adults have every right to use tobacco products, but quite honestly, we know when people become addicted to nicotine. It's between the age of 12 and 18. And when we have these inequities in how they're taxed, we roll kids and adults to other products. And so we would really strongly encourage you to just keep it as is, and have that 20% of wholesale. And let's see. I think that's it, if there are any questions. Thanks. Mhm.
Thank you, Mr. Chairman. I'm Jan Cartwright, representing the Wyoming Public Health Association. And I want to thank the committee for having this conversation around the tax on OTP, probably for a different reason than I'm speaking now. My request is that the OTP on other tobacco, or the tax on other tobacco products, including vape, be increased. I can share that fully 1/3, or 36.59% of students in Wyoming say that they have used vape or other e-cigarette products in their lifetime. And Wyoming was recently part of the Juul settlement that indicates that teens were targeted. And so Juul made those payments, including to Wyoming. So in my estimation and the work of the Public Health Association is that the value of a tax on from the health standpoint is prevention. And so my request would be that as you're having these discussions on OTP, that you also include a discussion of an increase in the tax. Thank you, Mr. Chairman.
Okay. Okay, Ms. Lewis, follow up?
Thank you, Mr. Chairman. I did want to go back to Representative Sweeney's question, if I could, when you were asking about the the two definitions, premium or large. And I did want to mention large cigar is used within federal tax codes. It is a distinguishing term. Premium exists, as I believe was mentioned earlier, only within the context of FDA regulation. FDA was, there is ongoing litigation and discussion about whether or not premium cigar would be regulated by FDA. And that's where the conversation and definition of premium came from. With regard to federal tax codes, large is a term that's used. And that is defined by 3 pounds per thousand. I think as Mr. Donovan mentioned earlier, that's can be more complicated from a retail and a consumer perspective to really understand, that threshold and what it means when the tax is applied, and trying to make those decisions at the retail level. But I did want to clarify that.
Okay. Up to the end.
Thank you, Mr. Chairman. So I just want to verify that, again, your current reading is that this cap only applies to cigars and not premium cigars. If this was amended to apply only specifically to premium cigars of whatever definition of premium cigar that we create in the legislature, the Cigar Association would be opposed to that.
Mr. Chairman, Representative Yin, we would be opposed to that.
Okay. Any other questions? Okay. Thank you, ladies. Appreciate you being here today and your testimony. Okay, and I believe we have 2 online. So if we could move to those folks. Are they all in state? Looks like. Can you hear us? I don't think we can hear you.
How's that? Can you hear me now?
Oh, there we got you loud and clear. Very good. Please introduce yourself and welcome.
Thank you, Mr. Chairman, and good afternoon to the committee. My name is Mary Zarmak. I'm the Senior Vice President of Government Affairs for Smoker Friendly and Gasomat. We're a family-owned business based in Colorado, but we have 10 stores in the state of Wyoming that we've operated since 1984. So Wyoming is definitely our second home. We love doing business up there, and I'm here today in support on 23 LSO 62. We are in support of the flat tax on the premium cigars and cigars in general. In fact, we sell cigars in all of our locations. We, like Mr. Short, have age-restricted stores. Even in our fuel locations, our gasomat locations, we have pay windows for underage consumers. They're not allowed inside the store. We have lounges in both Cody and Cheyenne. And I'm not going to really reiterate everything that's already been said by Mr. Short and the young lady from the CAA, but we are in support of the cap on cigars.
Okay, thank you, Ms. Armack. Any questions? Okay, Representative Gray?
Thank you, Mr. Chairman. I would appreciate if you could talk a little more about, the implications to your business and the current rates, because I think it's gotten lost. We talked a lot about it in Lander, and I think because we're getting so in the nitty-gritty on the language, we're losing a little bit what this has meant on the ground for a lot of our businesses here in Wyoming. So could you elaborate a little on that? Thanks.
Sure, I'm happy to. And actually, I kind of have some real world experience because we do have stores in 12 different states in our family business. And in 3 of those states, we have cigar tax caps on premium cigars in all 3 of those. And then in 2 of those, it's on all cigars. We do business in North Carolina, so I'm very familiar. This language is very similar to the language that was used in North Carolina, which we supported. And really what it does is these are really kind of an expensive luxury product, but I think the misnomer is that, it's strictly just rich old guys that are using it, and really guys of all skin colors, but rich old guys. That's that. And that's not really the case. I mean, we see in our lounges and in our stores that premium cigars have become, kind of a fun tradition and a fun habit for a lot of different socioeconomic levels of people. Yes, a lot of older gentlemen do like them, but we see women, we see a lot of police officers, firemen, a lot of different types of people. It's not just particularly some rich old white politician. Sorry, guys. But it's a variety of people. So these are very expensive products. So when you add a percentage of tax onto a very expensive product, it adds a lot to it. And the price continues to go up because of issues of product availability. During COVID, we had a lot of issues in the 3 main countries where we buy cigars from are Ecuador, Honduras, and the Dominican Republic. And it's, their largest export into the United States. I mean, it really keeps those countries running. And so we had a lot of issues, and prices really went up on products, just like we've seen in so many other cases. So to be able to cap the tax on these types of products, it helps our consumers, it helps your consumer. And to speak to the catalog business that was talked about a little earlier, we figure that 50% of premium cigars in the 12 states that we do business in, our consumers are buying almost 50% versus brick and mortar online. And not very many states, no offense to the gentleman at the Department of Revenue, but not very many states are being able to chase that down because of all of the things that were spoke about. It's a smaller amount of people that are buying them. They're smaller ticket items on a per purchase basis. So it's very hard to track them down and make them pay the taxes properly. But I would bet you a dime to a dollar that I could send any one of you a box of cigars from Thompson Cigars right online here, and there would not be a 20% tax on there, and no one would be chasing your tail. Well, they would be now because the Department of Revenue is in the room, but they would not be. I mean, that tax is just not being taken care of. So we are at a competitive disadvantage, our brick and mortar stores versus the online catalogs.
Okay, thank you.
I hope that answers your question.
I think it does. Thank you. That was really good. Okay, any other questions? Thank you for joining us. Who's next online? Do we have? Can you introduce yourself? Can we hear you?
Yeah, my name is Greer Bailey, and I serve as Executive Director of Wyoming Petroleum Marketers. I'm a poor replacement for Mark Larson. I just wanted to offer our association's support for the drafted bill. I think that the testimony that was given by the cigar shop owner in Casper was very salient. It's important for the committee to know that cigars are not subject to the provisions of the Jenkins Act. And as such, I don't think that it's feasible to think that a state Department of Revenue, even one as good as the Wyoming Department of Revenue, could fundamentally track all of the wholesale manufacturers cigars without federal government involvement and support. So more than that, though, consumption taxes, like fuel, are more stable and are more projectable for state revenue purposes on a unit or volume basis than on an ad valorem basis, and have a higher standard of comparative valuation with factors such as surrounding states and different product lines. And why that's important is I think that as you guys are determining whether or not this change is necessary, the committee, we would suggest that you should have kind of a fundamental basis on how much revenue you could actually project. And while inflationary measures are a factor in ad valorem taxes, they're not really as much of a factor in consumption or excise tax basis. And so just fundamentally from a policy perspective, the board does support this. To the question on Swisher Sweets, we kind of probably think that those are two different customer classes. Mary serves on our board as in Wyoming Petroleum Marketers, and I think that her customer that she's doing her own branded cigars or Mancudas or Rocky Patels is a much different customer class than Swisher Sweets. And so I don't think that it's kind of an apples to apples comparison to treat those things as the same. But certainly appreciate the committee's time, and we would support the draft as drafted. Thank you.
Just, can you tell us for the committee's benefit, your last name? You had us all kind of smiling when you said Mark Larson's, and you had an adjective for yourself. Very good replacement. Mark was great, but go ahead.
So Mark actually hired me about 10 years ago, and he left me in charge of Colorado for the last 5 years, which I haven't forgiven him for yet. So my last name is Bailey, though. It's Greer Bailey.
Okay, great. Thank you very much.
Thank you, sir.
Okay, any questions? Representative Yin has a question for you.
Mr. Bailey, Mr. Chairman, thank you. Mr. Bailey, so my question is essentially, does your interpretation of the draft reflect the same as Ms. Lewis's interpretation of the draft, that the cap applies only to all cigars? And if your interpretation agrees with that, would you still support it if it's amended to separate the cap so it's only on premium cigars versus all cigars?
Go ahead, Mr. Bailey.
Thank you, Mr. Chairman. So working in kind of a lot of states, my kind of experience with the premium cigar manufacturers is that they kind of default to the definition of hand-rolled cigars as kind of what constitutes a premium cigar. I'm not entirely sure where the board would be on a differentiation, but regardless, it doesn't undermine the underlying point where for excise taxes, consumption taxes are more adequately based on volume or unit based rather than ad valorem or value taxes, because then they're not subject to inflation. So, regardless of whether or not you want to include both premium and the machine rolled, I think that the association's board would be supportive regardless moving forward, and that would be kind of more of a question specific to the committee.
Okay, thank you. Any other questions? Okay, thank you, Mr. Bailey. Appreciate your.
Thank you, Mr. Chairman.
Okay, is there anyone else here that would like to testify in this bill? Go ahead, Mr. Garrett. And then we're gonna try to work this bill.
Mr. Chairman, members of the committee, Richard Garrett, and I'm here as a citizen of the state of Wyoming, and I want to thank you, all the members of this committee, for helping me retrieve my iPad too. So I shouldn't ask for two things in one session, but I am going to ask you to not lose sight of the opportunity, the potential opportunity to examine a tobacco tax, a cigarette tax, a meaningful tax on cigarettes at your next meeting. And if it is the committee's pleasure to direct the LSO to draft a bill, I know that you've heard this topic before. I'm particularly grateful to Representative Hallinan for his advocacy on this issue. A meaningful tobacco tax can make a difference in people's lives, their health outcomes, and if that tax or an amount commensurate with the tax is applied to health benefits and health outcomes, that could be of great benefit to the state of Wyoming and all of our people. So with that, I'd be glad to answer any questions.
Okay, any questions, Mr. Garrett? Okay, Representative Ross?
Yes. Thank you, Mr. Chairman. Mr. Garrett, can you tell me the tax rate of a surrounding state like Colorado, say something similar to either Colorado or Idaho, so we can compare our tax to what they're taxing on?
Mr. Chairman, and Representative Roscoe, if I may, I'd like to provide that to the committee in writing. But I believe our state tax right now is one of the lowest, if not the lowest, in our Rocky Mountain region. I believe that we're 40th or lower in terms of tax in the entire country. Our tax rate is lower than that of the state of Kentucky, for example, which thrives on tobacco in more ways than does Wyoming. So there are states that tax and impose a meaningful tax, and I think that the people of those states benefit. But I will get those numbers for you, Representative, if you'll allow me that privilege. Thank you.
Okay, thank you.
Thank
Any
you.
other questions, Mr. Garrett?
Thank you,
Okay,
Mr.
thank
Chairman.
you. Thank you for your testimony. Okay, I think we've going, Representative Gray for Mr. Garrett. Yeah, oh yeah, absolutely. You bet.
Mr. Chairman. On Mr. Anderson, Mr. Chairman, on page 4, Romanet I, and even Romanet 2, this is where the definition of premium cigars comes in. I think there's been some confusion on that. The cap on page 3, I think it's pretty clear, but how do we key in cigars into that? I mean, would we put that into, is that covered in 1 and 2 and Romanets 1 and 2? Because I'm not sure it is.
Mr. Chairman, you're correct. That would only apply. So the way this bill was drafted and the way I understood the request at the last meeting was to have the cap be similar to North Carolina, and that was a 30% cap on all cigars. And then there was also another part of the request that was to change how the tax is reported and paid. And that was requested to be through the premium cigars. So that's where that definition would apply. So you could change in either spot to either have it apply to all cigars or to have it apply just to premium cigars.
Okay, any other questions? Go ahead. Any other questions? Oh, you're good? Okay, any other questions? Okay, no one here. We're going to close public comment then. Going once, twice. Okay, public comment closed. Okay, members, what's your pleasure on working draft 62? Okay, it's been moved by Representative Gray, seconded by Representative Jennings. Okay, let's work the bill. Let's start. I'm going to scroll up here to first page. Okay, I'm going to scroll to page 2. Are there any amendments on page 2?
Let me catch up with you, Mr. Chairman.
Okay, for sure. I'll just pause here at page 2.
Mr. Chairman.
Representative Yin.
Mr. Chairman, I think Senator Pappas might have a motion, but I do think if we are going to separate premium cigars from cigars, we need a pretty strong definition. So curious on what the committee looks like.
Could you do just a simple marker where the Department of Revenue defines it in rule? I mean, you certainly could, because it changes, these things change, but that's another thought. Okay, go ahead. I think Senator Pappas, did you have a point?
Well, I was just going to make an amendment. To me, as we mentioned in testimony, D is not really particularly, because the premium cigar can be flavored or non-flavored, so that should go, and E and F as well. I don't think the weight or the, what's actually in the cigar, it makes it, what a premium cigar is, a hand-rolled cigar in my mind. So I would move that we strike D, E, and F.
Okay, is there a second? D and F, seconded by Representative Gray, okay? Any discussion on the motion to strike D, E, and F? Okay, all those in favor, I think everybody understands it. All those in favor of the motion, please say aye.
Aye.
Opposed, say no. That motion has carried. Any other amendments on page 2? Okay, we're going to move to page 3.
So,
Mr. Co-Chair.
well, Mr. Chairman, I'll venture and say, let's eliminate C from the bill. And that would leave it in law at 20%. The only difference it would be that it's going to be collected differently now, because if it's a premium cigar, it'll be collected at retail, given the language later on. So my motion is to remove section C. I guess that's page 3, right? Yes, from the bill.
Probably that whole 3918-104. Josh, you'll conform any of these.
Yeah, there's everything in 104, isn't it?
I'm just saying,
Yeah.
I don't.
Take
Josh
out
is nodding
104.
yes.
Yep.
Okay, is there a second on that?
Second.
Seconded by Representative Yin. Discussion? Go ahead, Representative Gray.
Thank you, Mr. Chairman. I'd really ask for a no vote on this. I think we've heard testimony from small businesses around our state on the implications of this, and I think it's a good piece of legislation. I think that these taxes have, we've seen in other states, these premium cigar taxes help small businesses in these states, and I think I think we should keep this language in the bill. So I'd encourage a no vote and consider that testimony that we heard earlier. Thank you.
Mr. Chair.
Thank you. Senator Pappas.
I too am going to be a no vote on this. I really think that, especially since the testimony I heard on not collecting this tax from online vendors, I mean, it puts our local businesses at a very disadvantage at their competitive prices. So I'm a no vote on this.
Anyone else? Representative Yin?
Thank you, Mr. Chairman. So Mr. Anderson basically confirmed that the way it's drafted is the 30% cap applies to every cigar. It says on line 9 and on line 20 on page 3 that is per cigar, not per premium cigar. So this doesn't divide out. It is just, we're just reducing the rate on cigars versus every other type of tobacco product.
Mr. Chairman.
Go ahead, Ms. Coach.
Well, to tag on that slightly, so 20% of some number, it's between $4 and $5, is 30 cents. So basically what that says is it caps it on those cigars if we were to do that. So, I mean, I'm not sure that's entirely correct to say it puts it on all the cigars. It doesn't, it only reduces it on cigars where 20% of the retail price, wholesale price, right, would be 30 cents. So.
Do you have a comment on that? Dean, do you have a?
No, Mr. Chairman, I think that would be a wholesale price of $1.50 would be 30%. 20% of $1.50 would be 30 cents.
Great, thanks. I think I got confused when 40,
So basically every.
50 cents was 20% of $5. I got confused on that one.
Cap on every cigar over $1.50.
Yeah.
Okay. Representative
So,
Yin.
Mr. Chairman, I think I generally would agree with that, except this is going to be in statute. So over time, as inflation moves on, it's going to apply to cheaper and cheaper as being whatever the current value of the dollar is. So it will eventually move into less premium cigars, even though it does create a dividing point now. And then the second thing I would say is that it does still have an economic effect where we incentivize more expensive cigars, and then we benefit those consumers that buy more expensive cigars. And I don't know if that's something that frankly is appropriate, because that is choosing winners and losers.
Okay, any other discussion? Representative Gray.
Mr. Chairman, I'd ask those that may have those concerns, to maybe come up with some language rather than just, deleting this whole section of a cap. If we need to work on it a little bit, but let's not delete the whole thing and just, not handle this whole situation where we have taxes aggregating for our small businesses. So, I mean, the motion is the motion, and I think that just really eliminates this portion. So let's keep it for now, and, if we need to, handle it either in committee in session or go into a break or whatever, but I think this motion's a little different from what was just discussed, so thank you.
Okay, thank you. Any other discussion?
Mr. Chairman,
Okay, Mr. Co-Chair.
slightly tangential, but I think it affects the whole discussion here. I think there might be a problem collecting the tax from online sales. I'm not sure about that. That problem may be easy to remedy or may be hard to remedy. It may be as simple as sending them all a letter. And and telling them that they owe the tax. And I'm getting some nodding. So I haven't given up on that route either. And I think that, if the committee doesn't want to take that section out, maybe we should raise the number, but let's try to get an answer to the online sales and at least try to go after it. And if we were collecting from online sales, I'm not sure we'd really need this bill other than the part for making it easier on the retailer to pay the tax when it's sold to the consumer. So that's my only comment. I still support the motion.
Okay, so with that, I'm going to vote on this motion. Okay, all those in favor of the motion, please say aye.
Aye.
Those opposed, say no. No. That motion has failed.
Mr. Chairman,
Go ahead, Mr. Co-Chair.
move take it up to $1.
So the motion is to change the
And I
30
can do
cents to
that
$1.
math. That'd be the $5 cigar.
Okay, is there a second?
Second.
Second by Representative Yin. Okay, any further discussion? I think we all understand it. All those in favor of the motion, please say aye.
Aye.
Opposed, say no.
No.
I'm unsure. All those in favor, raise your hand. To raise it to $1, 1, 2, 3,
I'm not sure what,
4, 5. All those opposed.
I'm not sure what online's doing.
All those, Representative Henderson, are you an aye or a no?
We can't see your arm.
No.
Okay.
I'm a no.
So all those opposed, raise your hand. Yeah. Yeah. 1, 2, 3, 4 online, 5, 6. So that motion is. Okay, I got a little question for a recount. Let's just start this over. I'm going to count Mr. Henderson as a no.
Stop the steal.
We're gonna, easy now. All those in favor, raise your hand. All those in favor of taking this to $1, raise your hand. 1, 2, 3, 4, 5, 6. Okay, all those opposed, raise your hand. 1, 2, 3, 4,
Online.
5, 6,
Mr. Chairman.
7. Okay, so that motion has failed. Okay, 7-6. 770, if I, doesn't matter, it failed. Okay, are there any other motions? That was a good one online. Couldn't see it. Okay, page 3, are there any other motions? Folks, I'd like to make a motion that this only applies the 30-cent cap to premium cigars. I mean, that's what we're talking about. That's what we're trying to help. I think it actually helps premium cigar sellers in our state. So now they're not going to the little cheapies. So that's my motion. Are there any? Second? Online, okay. I think you understand so it only apply to premium cigars, not all cigars. Okay. I think we all understand. That's the motion. Any discussion?
So, Mr. Chairman, then it would be the 30 cents on any cigar that's $1.50 or cheaper.
Premium cigar.
A premium cigar.
So,
That's
so then
defined.
anything $1.50 or cheap, or if it's any premium cigar, it doesn't matter, right? it's
right.
whatever the
But
cost is.
everybody else is 20%.
It's 30, and so it's 20% on, say if they've got a $1.50 cigar, like we said, it's going to be the same amount. So anything cheaper than $1.50 is still 30 cents.
Yes. But if you have a $5 non-premium cigar, right? $5 non, it's $1. It's 20%. Right? So I'm just trying to make this, focus this in on the
Okay.
premium
I think
cigar
I think-
sellers in
I
our
think-
state, not all cigars at every convenience store. That's what my amendment does.
Mr.
Did I have
Chairman,
a second?
Mr. Chairman? Oh.
Did I have a second? Online, I did,
Yeah.
okay.
Second.
Yeah, I forgot already. Okay.
Chairman, how does this affect the work of the department? As far as, is there a big workload there now, since now it's not all cigars, it's now,
Premium cigars.
yeah.
They'll have to go through some rulemaking certainly, and absolutely. That's what we do, yeah. Okay. That's the motion and the second. I think everybody understands it. This would apply, this 30-cent cap would apply only to premium cigars sold. Yeah, that, we would just add language on page 3. Okay, all those in favor?
Mr.
No,
Chairman.
further discussion.
Yeah,
Senator
just,
Pappas.
I think this makes a little bit more sense in light of my issue about fairness to our in-state vendors who are selling these premium cigars. I think that the disparity wouldn't be so bad if we're not collecting tax on these premium cigars at our 20% rate, then the cigars that our local vendors are selling, would only have to pay 30 cents rather than 2 to who knows how many, dollars per cigar. And so that goes a little, in my mind, helps out our local cigar stores. So I think that it's pretty good. The best solution is go ahead and pass tax on, or the cap on the premium cigars. So I just in favor of it.
Appreciate it. Thank you. Yeah, I do too. That's why I brought it. I think it helps the local cigar shop. Okay, anyone else? Discussion. Okay, all those in favor, how about we just raise your hand? All those in favor, I'm going to look online as a definite yes. Anyone else down there in favor of premium only? 1 online, 2, 3, 4, 5, 6, 7, 8. I'm 9. All those opposed, I think that'll pass. 1, 2, 3, 4, 5. So that motion is passed. So that cap applies just to premium cigars. We've defined it in statute so far in this bill, and it'll be defined further in rules.
It's great, Mr. Chairman. You're lowering the taxes on the rich.
Yeah. I'm actually helping small business folks in Wyoming. That's how we're doing it. Okay. That's what we're doing. Okay, any further amendments then on page 3? I think we wore that page out. Page 4. Okay. And that's the timing issue.
We like that.
And everyone likes that. Okay, through page 5, on to page 6.
Mr. Chairman.
Representative Yen.
Mr. Chairman, so it does appear that it does move premium cigars specifically to an excise tax similar to cigarettes instead of an ad valorem tax. And so effectively, and I would say that it doesn't make sense to do an excise tax specifically for premium cigars and not for regular cigars. So maybe, I'll just make a motion and we can discuss it. I'll make a motion to move all cigars to be an excise tax instead of an ad valorem tax. So which would essentially just be striking premium from a lot of that language, which hopefully Mr. Anderson can confirm that would do.
Okay, interesting. Okay. Is there a second? Okay, it's been seconded.
So,
Discussion.
Mr. Chairman.
Go ahead, Mr. Co-Chair.
I mean, I don't exactly see it that way. The excise is a cap of an ad valorem percentage. It's not really an excise tax. It's just that the ad valorem tax is capped at a certain level. It can't go above so much per cigar, but it's still anyway, I think that's angels on a pin, maybe.
Okay,
Mr. Chairman.
go ahead, Mr. Chairman, or Representative Yen.
Mr. Chairman,
Yeah, I'm trying to say.
on page 5B2, does this say, maybe it's a question for Josh, does it say that premium cigars are taxed in excise tax?
Mr. Chairman, I don't know that that was the intent to change how the tax was phrased, but just I jumped onto that existing language, and maybe I need to take a closer look at that, Mr. Chairman. But that, I think this change only was intended to change just how the tax is reported and at what time it's paid.
Thank you.
Okay, Representative Gray?
Thank you, Mr. Chairman. For clarity, what exactly is the motion? Are we striking premium from every reference on page 4 and 5? Because I'm not tracking
Is there,
exactly.
let me just, there is a second, right? Okay, yeah, very good. Yeah, go ahead. Question, restate that question again. That was good. Can you say that question again,
Yeah,
Representative Gray?
thank you, Mr. Chairman. I'm just trying to understand what the motion is. Are we striking premium from every reference in page 4 or 5, or which reference are you striking?
Representative Yen?
Mr. Chairman, I think I will withdraw my motion because it does seem that it's specific to the reporting and the timing to understand that premium cigars will be taxed differently. So maybe it doesn't make sense.
Okay. Very good. Okay, we have a motion on the table. Any further discussion? All those in favor of the motion, please say aye. Oh, you withdrew it?
Chairman, I will withdraw my motion if it's okay with the second.
You withdrew it. Okay, I missed that part. Sorry. Okay. Any further amendments to the bill? We about smoked this bill pretty good. We worked it over pretty good, Mr. Short. Okay. Any further amendments? Question being called. Please call the roll on LSO draft 62 as amended.
Senator Baldwin. Senator James. Senator Pappas.
Aye.
Senator Schuler. Representative Baker.
Aye.
Representative Gray.
Aye.
Representative Hallinan. Representative Henderson.
Aye.
Representative Jennings. Representative Roscoe. Representative Sweeney. Representative Yin.
No.
Co-Chairman Case.
No.
Chairman Harshman.
Aye.
That passes.
Okay. And we have one more.
Mr. Garrett will like this one.
And we have one more, and it's a potential bill to change the taxation rate, the excise rate on cigarettes, other tobacco, just cigarettes, I believe, right? On cigarettes. Yes, it is. Okay, Josh, you want to just give us a quick primer on this? And
Sure, Mr. Chairman. 23 LSO 63. This was another request that came out of that first meeting with the idea of increasing the cigarette tax, but with a blank rate. So currently, there's no amounts listed in this bill on page 2. The current rate of 3 cents works out to 60 cents for a pack of cigarettes. That's the bill as it is, Mr. Chairman.
okay, members of the public would like to testify on this? Please come forward, Ms. Cartwright.
And Mr. Chairman, it's okay for the testimony to be kind of the same as last time and quick.
Thank you, Mr. Chairman. Jan Cartwright, representing the Wyoming Public Health Association. I again want to thank the committee for talking about this important topic. The 60-cent tax that's currently on cigarettes has been the same since 2003. And my goal in speaking today is to talk about the importance of raising it by at least $1, and we would talk about $1.25. Currently, 15.7% of Wyoming high school students smoke, compared to 4.6% nationally. To Representative Roscoe's question, the surrounding states for cigarette tax, not OTP tax, is Montana is $1.70, South Dakota is $1.53, Colorado is $1.94, and Utah is $1.70. So if Wyoming were to raise its tax to be at least equivalent to those surrounding states, that would be our wish. The last point I want to make is that 12,000 kids that are alive today will die from their own smoking. So that reason alone should be the important topic for this conversation. Prevention, again, as I said before, is the reason for a tax from a health standpoint. Thank you, Mr. Chairman.
Okay, thank you. Anyone else would like to testify?
Any questions?
Any questions of Ms. Cartwright? Thank you for being
Thank
here. Ms. Schuler, Senator Schuler has a question for you.
Thank you, Mr. Chairman. Just a quick one, and I don't think it'll take too much of a, you probably know the answer to this already. You mentioned the rates of the states around us in terms of what they charge, but how does our rate of teen smoking compare to those states around us?
Okay, very good question.
Very good question, Mr. Chairman. May I yield to my colleague sitting next to me because I don't have the most current
Your
information.
4% was nationally.
Oh, I'm sorry.
Your 4% of teens nationally compared to our 15%, but I
right.
think the question was more specific to our surrounding state.
Oh, okay. That information I would have to get to you, and I would be happy to do that. Thank you.
Okay. Okay, thank you. Okay. Hello, introduce yourself again, please.
Chairman Harshman and members of the committee. For the record, again, my name is Kristen Page Nye with the American Cancer Society Cancer Action Network. And was excited to see that this was on your guys' docket for discussion. In the discussion, and as we've talked about previously, our organization strongly encourages you to not just look at increasing the tax on just cigarettes, because there will be an unintended consequence of rolling people to other products, especially our youth, and would really strongly encourage you to make this into a tobacco tax increase and look at how if you raise it, for example, $1.50, which is what we would suggest, because for the public health impact, you want it to be a significant increase so that you reduce youth use of cigarettes, and then do a comparable amount for those other tobacco products, and really looking carefully at even our surrounding states of how they did that, because when they did increase their taxes on cigarettes, they also did increase their taxes on other products as well. And again, it's about those unintended consequences and the cost. I'll just remind you, in Wyoming, I was trying to see where it is here. Sorry, I apologize. It's just a significant amount of money that we pay out in healthcare costs. And I will provide that to you in writing because I lost it in my notes. But remember that tobacco really does cost the state of Wyoming a lot of money, not just taxpayers, but we as individuals who pay premiums for our health insurance as well. And it's important for us to keep on top of that and make sure that kids do not start these habits. Thanks.
Thank you. Any questions for Ms. Page? Okay, thank you for being here today. Okay, anyone else would like to?
Good evening, Mr. Chairman, members of the committee. My name is Ashley Harpstreet. I'm the Executive Director for Wyoming Taxpayers Association. Wyoming Taxpayers Association is a 501c4 think tank with a 501c3 research arm. Our mission is to advocate for sound tax policy for a healthy Wyoming economy. Positions that we take are based on an analysis of legislation against the cornerstones of taxation through our policy committee. Their recommendation is then forwarded on to my 21 board of directors for a decision. In the analysis, as I mentioned, we look at the 4 cornerstones. Is it justified? Is it equitable among taxpayers? Does the proposal create a stable revenue stream? And finally, is the tax transparent, visible, accountable, and audible? Based off that criteria, Mr. Chairman, WTA does oppose 23 LSO 0062 cigarette tax as it fails to meet sound tax policy for the following reasons. It is not justified, as Wyoming adult consumers have paid the following taxes in 2021. State excise tax, $16.5 million. State sales tax, $6.6 million. Federal excise tax, $27.7 million. MSA and other fees, $19.4 million. In total, Wyoming consumers pay $72.5 million in taxes. Please note these figures do not include taxes paid on all other tobacco products, including MST. Additionally, as we analyze, the primary intent of this tax is to raise revenue or modify behavior. In this case, behavior modification is backed by statistics, and it turns into where the adult consumer will go to purchase their cigarettes. The true behavior modification is that the sales will go elsewhere, including the gray and black markets, reservations, and internet, thus ultimately destabilizing Wyoming's current tax that we have in place. It is not equitable, as excise tax are inherently regressive, costing lower income adult consumers more per capita than others. Based on CDC data, 35.9% of adults in Wyoming who earn less than $15,000 annually are smokers, whereas only 12% who own more than $50,000 or more are smokers. This proposal is a 40% increase on those that can least afford it. Also, it is inequitable because the tax will distort economic behavior with cross-border sales, along with a rise in illegal gray and black market sales. This tax is not stable, as many states have experienced a decline in government tax receipts after increasing their state excise tax. Furthermore, a recent nonpartisan study from Mackinac Center for Public Policy shows that higher taxes increase the sale of counterfeit and illegal products significantly. Since Wyoming's state excise tax under the bill would be higher than Idaho and Nebraska, and remember, the reservations are not required to collect any state excise tax, a massive shift in cross-border and illegal sales is inevitable. Finally, there are concerns for transparency. Only up to the point of Department of Revenue can capture this increased revenue on gray and black market sales. Regular enforcement to prevent those sales, per the information we talked about under stability, is extremely difficult. Thank you, and I'll stand for questions.
Okay, thank you. Any questions? Go ahead, Representative Yen.
Thank you, Mr. Chairman. I'm going to be a little spicy today. I'm curious on where the equitability conversation was on the last bill and whether your organization took a stance on that and just didn't testify.
At this point, we had not received a policy request. Oh, sorry, Mr. Chairman, Representative Yen. At this point, we did not receive a policy request on that.
Okay, anyone else?
Mr. Chairman.
Chairman Case.
Mr. Chairman, Ms. Harshreys, thank you very much. I think that the issue of reservation sales is really important in all of this. It's not true, though, that the Wind River Reservation doesn't impose the tax. Actually, what we have is a settled agreement as to what level, what percentage of sales would be taxed. And it's based on a historical arrangement between the tribes and the Department of Revenue, where they agreed that a certain estimate of sales were going to non-native people on the reservation, and that they would pay a tax on that. That was prior to the casinos and prior to the big smoke shops, I think. And so it's no doubt out of whack. But what it does mean is that basically cigarettes are definitely cheaper on the reservation, and the retailers in like Riverton and some of petroleum marketer folks, they know there's a big differential between on-reservation and off-reservation sales. And Mr. Chairman, so that is an implication for this, and raising taxes will only make that worse. This committee in the past passed a bill that authorized the governor to enter into a compact with the tribal sovereigns on the reservation to develop a way where we could both entities could tax cigarettes. Reservation cigarettes would be taxed, and non-reservation, of course, taxed the way we do now. And in this manner, any cigarette that's sold on the reservation would have the same level of tax as it is off the reservation. The difference is that the reservation governments would be able to keep that tax. That's what we're trying to get at with the compact. It gives them funds available for their programs, perhaps prevention. It doesn't say what they have to spend it on, but it solves the problem. And in the past, Mr. Chairman, I've been kind of picky about this and said we shouldn't be increasing cigarette taxes until we fix this problem because it'll only make it worse. And I think that's the gist of Ms. Hartstreet's statement. And I hope I got all the facts right. Mr. McNiven is here and he knows a little bit about this too. But isn't that kind of the gist of your testimony and why we have a problem?
Mr. Chairman, Chairman Case, I would agree to that point along with border states.
Right. And Mr. Chairman,
Go ahead.
in looking, we mentioned the states that are higher, but Nebraska and Idaho are both lower, slightly lower than Wyoming. I think Nebraska quite a bit lower. So it's just something, all this weighs on the table.
Okay, very good. Any other testimony, any questions? Okay, testimony.
Thank you.
Okay, come on up and just have a seat. We'll key both of you up. Anyone else in the room that would like to testify? Just these two gentlemen? Okay, and then we'll move. Is there anyone online that wants to testify? What's that? Oof, okay, very good. And then I think is this the end of the in-person testimony? Anyone else here? And then we'll move to online and then we'll take a motion on the bill. Okay, go ahead.
My name is Jan Charles Gray. I'm my father of
Microphone.
Jan Gray.
And if you could just push that, yeah, there you go. Gotcha.
My name is Jan Charles Gray. I'm the father of Charles Jan Gray over there. And I turned 75 in June. I've never smoked even a puff on a single cigarette. And I wanted to smoke a cigar because I thought it was macho, but I haven't smoked a cigar yet, even a puff. But I wonder if anybody knows the number of people, because I know in South Dakota on the border, there are many people cross the border to buy cigarettes. And when they buy cigarettes or cigars, they also buy other things. And so I wonder whether anybody had thought about the impact of the people that are coming from these states that have higher cigarette taxes and whether or not it might not be beneficial overall to the state of Wyoming to have the lower tax.
Okay, very good. Okay, thank you. Any questions for Mr. Gray? Okay, thank you. Okay.
Mr. Chairman, members of the committee. Ooh. Try this one. Mr. Chairman, members of the committee, Mike Mosier, Wyoming State Liquor Association. Gaming and tobacco in one day, I feel like I've won the lottery. We are opposed to this. That's probably not a surprise to you, but I would actually be opposed to it even if it was another product. For example, we know that obesity is a major driver of healthcare costs. Lots of places tax sugary drinks. Wouldn't affect me because I'd rather drink Clorox than a sugary drink. But on the other hand, I would oppose that because you're singling out a specific person for whatever they choose to do. Sin taxes, whether you consider them sugary drinks or whatever they are not good tax policy. I'll get into the other reasons. This came up before. I represent retailers, obviously. So does somebody else online. As was pointed out, there are several states, Nebraska at 64 cents, Idaho at 57 cents. For reference, North Dakota, which isn't that far from Wyoming, is at 44 cents. Smokers do not buy packs of cigarettes for the large part. No more than a beer drinker buys a beer. They buy a 6-pack or a carton case, excuse me. So when you're talking about a dollar increase, you're really talking about $10 because that's what they buy it in. If you're in Cheyenne, for example, and you get to drive 45 miles to Kimball and save $10 a carton, you're driving. Not a lot of men aren't very price sensitive on some things, but if it's alcohol or tobacco, we are. Those states will get business, as the good co-chairman mentioned. The reservations are a major issue. So we're talking, and the Mackinac study was referred to, and as Mr. Gray mentioned, it's not just cross-border of Wyomingites going to other states. Right now, we're doing cross-border from other states into Wyoming. And so, for example, in Cheyenne, we're experiencing a lot of Coloradoans coming up to buy cigarettes at a cheaper price, $10 a carton cheaper, for example. That will flip, that will stop from Colorado, and the sales we have will now go to Nebraska. And so this will hurt retailers. I find a certain irony that the last bill was to help retailers, and this would hurt many more for those same reasons. I call it the law of diminishing returns in taxation. When you actually bring in less money, or potentially bring in less money than the tax increase generates, just because you lose those sales. Also, illegal retail to retail sales. I was a tobacco retailer once because I had a bar and we sold cigarettes, and it was cheaper for me to buy from a big box store than it was for my wholesaler. Saved $5 a carton. Of course, I didn't do that because that would have been bad in the eyes of the Department of Revenue. Okay, maybe I did, and the statute of limitations has run out, but you will travel to save $5 to $10, and that's exactly what would happen here. It's been mentioned there have been no tax increases since 2003. Yeah, there have. First of all, to put things in perspective, in the 80s, it was 4 cents a pack of cigarettes. Then in the 90s, we added sales tax, because prior to that, and I filled out the tax forms, cigarettes were tax exempt, like a food product, I guess, green leafy vegetable, something, I have no idea. Sales tax was added. Also in 2007, the federal excise tax went from 39 cents to $1.01. If we're looking at a $1 increase, the numbers show that a cigarette smoker will pay more in tax, pay over 50% of the amount of that pack in taxes. I don't know of any other product that's taxed at that level. Health insurance was brought up. I'm on the ACA. I'm not old enough for that other program yet. But I would pay 50% more on the ACA if I were a smoker. I'm not. But on the other hand, those people are already paying them lots of ways for what they do. Now, quick question, committee. We're not talking about, this is the ultimate tax thee, not me. I doubt anybody in this room is a smoker. On the other hand, we probably wouldn't know, because there was a recent study, Gallup poll study, this was fascinating, that showed that 11% of Americans smoke cigarettes. 16% smoke marijuana. And so cigarettes are so ostracized that marijuana is actually, we're reaching a point, members of the committee, where Junior comes home from high school and his mom says, "You smell like smoke, what have you been doing?" And he said, "I'm sorry, Mom, I'm smoking marijuana." And she'd say, "Thank God, I thought it was cigarettes." And so it's really become kind of an anathema. The people we're taxing, I mentioned I was at the American Legion, which I frequent sometimes, for a meeting yesterday, and I was pondering this tax because it came up in the meeting with the retailers, and obviously in Cheyenne, to the retailers, this is a major issue. And I thought, who are we taxing here? And so as I was walking out of the American Legion, there were about 6 people in the smoking deck smoking cigarettes. Those were all older, veterans, probably fixed income or retired. Those are the people we're taxing, ladies and gentlemen, or lady and gentlemen of the committee. We're not talking about taxing the higher socioeconomic group to the large part. Essentially, this is about the most regressive tax you can possibly get. Alcohol tax we can consider a regressive, but that spreads throughout all income brackets. In this case, you're targeting the lower socioeconomic bracket. Without belaboring too many points, because you've heard me do this before, this bill would hurt businesses significantly, especially depending on where you're at. If you are in the western side of the state, they're going to Idaho. In the eastern side of the state or southern side of the state, they're going to Nebraska. If they're in the middle of the state, they're going to the reservation, especially if they are on limited incomes, because at that point, $10 a carton makes a lot of difference. And so they'll make that trip. The policy involved in this, when we're talking $2 billion in the black, and we're talking about raising taxes significantly, on perhaps most of the Wyomingites who can afford it the least. I really have to oppose this on not just what it does to my businesses, but also what it does to us. You may hate smokers. Maybe you think they're the most disgusting creature known to mankind. But on the other hand, there are people, there are friends, there are citizens. And I don't feel that this tax is appropriate at this time. And I would ask you to oppose the bill, and I'll take any questions.
Any questions? Okay,
I got a question.
okay, Senator Pappas.
Yeah, Mike, are there, you know, we discussed earlier with the cigars that there's an online business, right? Do people buy, I don't know, do people buy cigars or cigarettes online? And would that, I mean, if we raised it, would online sales or, I mean, why aren't people from Colorado, if they're coming over here, why don't they just buy it online?
Mr. Chairman, Senator Pappas, that is illegal for cigarettes. That was federal action. On the other hand, the counterfeit market is sizable. You would be surprised, I won't mention the country, but it's a country we love so much on the other side of the Pacific, knocks off Marlboros, and you can't tell the difference. And that's a lot of the stuff that's sold online. You can find online cigarettes in a heartbeat. Unfortunately, the good folks at the Department of Revenue, and this applies to alcohol too, have no out-of-state enforcement. And so if I order 10 cartons of Marlboros online, whether they're real or not, it's not like anybody's going to nail them for it. So that black market exists. Would it be exacerbated? Yes. Thank you, Mr. Chairman. Thanks, committee.
And we'd ask folks, the hour's getting late. And we've got 4, and please be brief, and we'll appreciate everybody sticking with us.
Okay, whoops. What? Can you hear me?
Okay, we're on this bill. Yeah, welcome back. Go ahead.
Thank you, Mr. Chairman, and good afternoon, now evening to the committee. I'm still Mary Zarmak, and as far as I know, no one's called me and fired me, so I'm still the Senior Vice President of Government Affairs at Smoker Friendly and Gasomat. I won't go through all of that, you know, or a little bit of our history. Cigarette, I'm here, obviously, in opposition to LSO 63. Cigarette and tobacco taxes are always regressive. They affect lower income, as has been mentioned, that can least afford it, and especially in the economic environment we are currently in. A few of the people that spoke before really teed it up for me because, as you are all aware, Colorado passed a ballot initiative that went into effect on January 1st, 2021. It was a huge increase that resulted in a huge loss in sales in some of our Colorado stores, primarily, amazingly, in our, northern Colorado stores. However, this resulted in over a 50% increase in each of our Cheyenne store sales in tobacco items. We are up 40% in fuel at our Cheyenne Gasomat. We're up 35% in our Laramie store. So to say that people won't make a drive, and I think it was Mr. Gray mentioned, be interesting to know, are they buying other things? And I can unequivocally say, yes, they are. You are getting some very nice business from Colorado, at least in those 3 particular locations. As it happened in Evanston, Wyoming, many years ago when Utah raised their prices, or as it happened in our Sheridan store several years ago when Montana raised their prices. So do people make a drive for tobacco, for cigarettes in particular? Yes, they do. And do they buy other things? Yes, they do, because your excise tax on fuel is a little bit lower than Colorado's. So fueling up makes a lot of sense. Your liquor prices are a little bit lower than Colorado. So stopping at the local liquor store makes a lot of sense. We actually have a liquor store attached to our Gasomat and Smoker Friendly in Torrington, and we see that store is booming as well. And that's a pretty long drive, but it's interesting how much, and one of the things that always irritates me is I hear people say borders. And in reality, we have state lines the last time I checked. And these consumers that are driving over the state line from Wyoming to Colorado, or from Colorado to Wyoming or Nebraska or any other state line, you've never been checked at a border. It's an actual state line, and you are allowed to go and give business to other states, whether it be recreational, whether it be, you spend money at hotels, restaurants, gasoline stations, buying alcohol, buying tobacco. None of that is against the law. So, Wyoming has been definitely a beneficiary of these high taxes on cigarettes in some of these surrounding states. And I couldn't agree more that these consumers will go to other states, whether it be Idaho or Nebraska. And to answer one of the committee members, I think it was Mr. Pappas, the PACT Act prevents cigarettes and moist snuff from being sold online. And actually the delivery people, starting with the US mail, but FedEx signed on to it, UPS signed on to it. So none of the delivery companies will deliver cigarettes to homes. So it is against the law. And I would just thank you for all listening. And again, I'm opposed to this regressive tax, and I'm happy to answer any questions. And thank you for all your hard work.
Thank you, ma'am. Any questions for the lady? Seeing none, who's next? Shall we go to the gentleman? You're on mute, sir.
Thank you, Mr. Vice Chair. I also wanted to appreciate the comments.
I'm actually the chairman now, so.
Okay, thank you, Mr.
I
Chairman.
don't like vice. Yeah, thank you.
Thank you, Mr. Chairman. I wanted to appreciate the comments relative to our friends in the sovereign nation. I won't belabor that point, but I thought that you covered it really well. And it's still an issue, especially for our chairman of our board in Wyoming, who actually operates in Riverton. So thank you for those comments. I thought Mr. Mosier, Ms. Sarmack, and Ms. Hapschath did a great job. But I also wanted just to note that the industry is trending away from combustible products. Youth use of combustible cigarettes is an all-time low, and the FDA is currently evaluating banning all menthol cigarettes. So it's strange that the Revenue Committee in Wyoming would tie a proposed tax increase and subsequent budget projection to products which make up a significant portion of the line that might soon actually be banned. So as you guys are evaluating revenue projections and trying to sustain the Wyoming budget, I mean, if the FDA bans those things, then they're basically taking the legs out from under you. What WPMA suggests that there's actually nothing wrong with Wyoming benefiting from flawed policies in surrounding states. Wyoming gets tax receipt benefits, and you also get to continue to avoid regressive taxation on an increasingly smaller and aging percentage of the population. E-cigarettes continue to be an issue in our industry, and youth trends, both in Wyoming and nationwide, while trending downward, continue to be an issue. But a bill that simply taxes cigarettes without addressing core underlying issues is not something WPMA should support. And for that, we respectfully ask for your opposition to this bill. Thank you.
Thank you, sir. Any questions for the gentleman? Any questions? Thank you very much. Who's next? Ms. Albers, thank you. Go right ahead.
Good afternoon, Mr. Chairman, members of the committee. My name is Liz Albers. For the record, that's A-L, B as in boy, E-R-S, and I'm here representing the American Heart Association. I will be brief, as some of the proponents in the room have already made some of the more salient points. The American Heart Association's mission is to be a relentless force for a world of longer, healthier lives. Accordingly, we support this committee's discussion around increasing the cigarette tax, support a bill draft that includes a tax increase to $1.50 per pack of cigarettes and a tax on cigarettes as well as other tobacco products. We know that tobacco taxes are a proven way to reduce and prevent the use of tobacco products, particularly among young people. tobacco taxes increases help make tobacco products too expensive for price-sensitive kids to buy, in addition to giving adult smokers another incentive to quit. We asked for the tax of $1.50 because we know that in order to have the greatest positive impact on public health, a tax increase needs to be significant. This is because we also know that a small tax increase is easily offset by discounts, coupons, and buy one, get one free offers that tobacco companies frequently use to keep people buying their products. We also encourage a tax not just for combustible cigarettes, but all tobacco products, as the good done by a tobacco tax is lessened when smokers simply switch from one tobacco product to another because of that product's lower tax. And I'm sure this committee is aware of the e-cigarette epidemic among our youth. Therefore, increasing the price of tobacco products, including e-cigarettes, through taxes remains one of the most effective tobacco control interventions, because it also helps to keep kids from picking up any type of tobacco product. Additionally, while the health costs of tobacco are high, the deadly product also costs the U.S. economy billions of dollars. Wyoming experiences 202.4 million in productivity losses due to smoking each year. Significantly increasing tobacco taxes is a proven strategy for generating revenue while saving lives and healthcare dollars, as in preventable healthcare expenditures and lost worker productivity. Smoking is estimated to cost Wyoming $258 million in direct healthcare costs annually, including $4.48 million in Medicaid costs. Therefore, we're asking that you increase the cigarette tax by $1.50 with a parallel tax on all other tobacco products in order to provide a substantial source of revenue for the state while reducing tobacco use and tobacco-related healthcare costs. There were a number of issues raised by other speakers, specifically with regard to businesses. Money spent on tobacco products in retail stores does not simply go away with reduced usage of tobacco products. Rather, consumer spending shifts to other products or services. In fact, a study analyzing tobacco taxes across 50 states over 13 years found that there was not a drop in the density of convenience stores after the tobacco tax was implemented. The study actually revealed a slight uptick in the number of stores. There's also this issue, I think, of cross-border states, people going across state lines to buy tobacco. The average consumer is not going to spend both time and money on transportation for routine purchases like tobacco products. We've simply never seen it to be true, as there are many states that share high-low tax borders, and we do not see mass border crossings for tobacco purchases, for instance, between Washington and Idaho, Oklahoma, Missouri, New York, Pennsylvania, and Minnesota and North Dakota. We haven't seen it occur. So I thank you for your discussion on this important issue, and I'm available for any questions you might have.
Thank you very much. I think we have one question. Representative Yan.
Thank you, Mr. Chairman. Ms. Albers, since you're from a national organization and maybe you have insight in how other states are being lobbied to keep their cigarette tax low, do you hear the same cross-state line argument in both Nebraska and Idaho as the reason that they haven't raised their tax rate? Are we essentially being pitted against each other just to keep all 3 state tax rates low?
Ms. Albers.
Mr. Chairman, Representative Yin, thank you for that question. I would have to check with my colleagues in Idaho and Nebraska, but I imagine that is the case.
Thank you. Anybody else? Thank you, Ms. Albers. And last but not least.
Thank you so much, Mr. Chairman and the members of the committee. My name is Amy Speaker, and I am the Director of Community Health at Cheyenne Regional Medical Center. And I want to thank you for your consideration of these issues and just share a couple of key points. So as Mr. Garrett talked about earlier, Wyoming is ranked 44th in the United States for its cigarette tax at 60 cents per pack compared to the national average of $1.91. Significant tobacco tax increases, as have been discussed, of $1 or more as best practice, have produced substantial new net revenues in states in which they've been passed. And those substantial increases in cigarette tax revenues were above what they would have received absent of a tax, any rate increase. In Wyoming, the American Cancer Society, the Campaign for Tobacco-Free Kids, and others have projected a new annual revenue from increasing the cigarette tax by $1 per pack to $20.16 million. We have heard that sometimes tobacco tax can be categorized as regressive and said to hurt lower income individuals. However, lower income smokers are much more likely to quit because of tobacco tax increases. By prompting more lower income smokers to quit or cut back, raising state cigarette taxes will reduce those regressive harms and costs, directly helping lower income smokers and also reducing smoking caused costs and harms to their families. A pack-a-day smoker who quits on average will save $3,000 annually, freeing up money previously spent on cigarettes for much more productive uses in their families. As has been mentioned, there are also public health benefits to increasing tobacco taxes. It's one of the most effective ways to reduce tobacco use, which remains the #1 cause of preventable death in the country. And I believe Senator Schuler asked about the tobacco smoking rates in states in our region. Wyoming is the highest at over 18% of adults smoking. We're really close to South Dakota, which also has a pretty low tobacco tax. Smokers are more likely than non-smokers to develop serious and costly conditions such as heart disease, stroke, and lung cancer. Nationally, every 10% increase in cigarette prices reduces youth smoking by about 7% and total cigarette consumption by about 4%. Cost savings are substantial, as you heard just recently, for not only for the individual, but also for the state. We see high costs of direct healthcare costs of $258 million, Medicaid costs of almost $45 million, and lost productivity in workers of over $200 million. As far as cross-border states go, actual state experience and published research reinforced findings from both the National Research Council, Institute of Medicine, and the Cancer Institute World Health Organization reports show that smuggling and tax evasion not only fails to eliminate revenue gains from cigarette tax increases, but it's also a much smaller problem than the cigarette companies claim, especially when compared to the additional new revenues, public health benefits, and smoke caused reductions from state cigarette tax increases. In conclusion, raising cigarette excise taxes can reduce consumer demand, thereby prompting individuals to attempt to quit, discourage youth initiation, increase state revenue, and yield considerable health savings for individuals and state health programs, specifically Medicaid. Again, I appreciate your consideration of this important issue, and I'm happy to stand for any questions. Thank you.
Any questions for Ms. Speaker? Any questions? Ms. Speaker, you mentioned which Dakota did you say had low taxes? Do you remember?
Sorry, South Dakota. Let me, sorry, I was thinking of North Dakota.
I think
I was mixing them up. I'm sorry.
It's easy to do, but I show that North Dakota has 44 cents and South Dakota has $1.53.
That's correct. And South Dakota's smoking rate is at 18.3%, which is similar to ours at 18.4%. Sorry, my fault.
Okay, thank you very much. Any questions? Thank you very much. Is there any other testimony online? And any other testimony in the room? Ms. Cartwright? Is this your second bite at the apple?
Thank you, Mr. Chairman. I just wanted to follow up on,
Please.
I just wanted to follow up on Senator Schuler's question about the high school smoking rates in those surrounding states. Wyoming at 15.7, Montana is at 7.7%, Colorado is at 3.3%, Utah is at 2.2%, and South Dakota is at 12.0%. So thank you.
Thank you very much for that. Is there any questions for Ms. Cartwright? Thank you very much. Okay, anybody else?
Mr. Chairman, before we leave public comment.
Yes, Representative Sweeney.
Going to the tribal issue that was referred to. So has there been any progress in those discussions with the tribes on trying to come to some sort of resolution?
I'm looking for Mr. McNiven, but as I understand it from the governor's office, which briefed the Tribal Relations Committee a couple weeks ago, the essence is the governor has extended the idea to the tribes and has not heard back from them. I mean, they're considering it. I know they're considering. I didn't mean that to sound like they're not considering, but they're giving it some thought. So that's a very big key to making this work in Wyoming, but we don't have that on the table now. Not seeing any more public testimony. I think we'll close public testimony. And committee, you've heard the testimony. What is your pleasure? I've got a Hallinan hand back up there. Go ahead, Representative Hallinan.
Mr. Chairman, I move the bill.
Okay, we got a motion on the bill. You want to just throw a tax in there to get us started because we got to do something.
Yes, Mr. Chairman, if I may.
Go ahead.
I would propose that on page 2, line 1, that would read 5.2 cents.
Okay, let's see if we got a second for your motion. So it's Hallinan moves the bill at 5.2. I've got a second from Baldwin. Discussion. Dr. Hallinan.
Thank you, Mr. Chairman. I listened to the testimony on both sides of this issue. For those that feel that the tax is too low and don't want to raise it, they want to raise it a large amount, $1 a pack. I would say that we've had this bill before us for the last 10 years, and it's been beat every time. So I think that we need to look at this bill as a reflection of the inflation that has taken place since 2003. Since 2003, if we had the same tax in 2003, it would be 34.2 cents in 2003 dollars. So we've had a tax cut on cigarettes down to 34.2 cents since 2003. By raising the rate to 5.2 cents a cigarette, that would make the cost of a pack of cigarettes tax be approximately $1.05. That would allow about a 45-cent increase in the cost of a pack of cigarettes. I don't know how much that would discourage young people from smoking, but I think it would discourage them somewhat. I think by not enacting a bill at this time, we are encouraging people to smoke more by that 34.2 cent tax that we would now have, or that we would have related to the old 60-cent tax, just by the reduction in the cost of the dollar, or the value of $1 since 2003. So for those that say that we would lose these sales to people from out of state, I would say that the tax would only go up about 45 cents a pack. And I don't think that would discourage them from coming into the state as well. They might still come in because it's still less than it is in South Dakota, Colorado, Montana, and Utah. So I think this would answer this is kind of a sweet spot. It does not raise tax above the amount of inflation that we have had since 2003, but it does not discourage people from coming in to the state to buy cigarettes here, and it does not allow the cigarettes to be so cheap that people are going to be smoking that they would otherwise quit by a small increase in the price of the cigarettes. So that's my reason for this bill. Thank you, Mr. Chairman.
Thank you very much, Dr. Hallinan. Okay, the chair is going to use his prerogative to divide the motion. Remember, the motion is on the bill at a certain tax. I'm doing this to avoid having to do a roll call vote on each time we mess with this bill. So I'm going to try to do that in a way. Let's just talk about the rate of the tax. So I'm dividing the issue of the 5.2, and we will discuss the 5.2 and are not. So discussion on the 5.2. Any discussion? Working down this line? Are you ready for a vote on the amount of 5.2? And it'll be a voice vote. And then we would have a following roll call on the bill. Representative Sweeney.
So we're talking, thank you, Mr. Chairman, 0.0052 per cigarette?
Correct. Which times 20 cigarettes per pack, that's where you get your tax. So it's
Okay.
2 times 20, I think it's $1.10. $1.05. I'm not doing my cloudy on math today. Getting old. $1.04. Okay. $1.04 per pack. Any further discussion? All those in favor of the 5.2, raise your hand. Got 1, 2, 3, 4, 5, 6, 7. Chair votes aye. So it looks like that carries. Back, any other motions on the bill? Would you call the roll, please, on the bill?
Senator Baldwin. Senator James. Senator Pappas. Senator Schuler. Representative Baker. Representative Gray.
No.
Representative Hallinan. Representative Henderson.
No.
Representative Jennings. Representative Roscoe. Representative Sweeney. Representative Yin.
Aye.
Co-Chairman Harshman.
Excused, he didn't leave a proxy.
Chairman Case.
Aye.
That passes.
I think that's everything we have for today, everybody. So we start tomorrow at 8:30 again, is that correct?
Mr. Chairman,
Representative Sweeney?
you've been invited, Wyoming Arts Alliance is providing a cook-up. It's up on Casper Mountain. I'd have to try to help give you directions, but
What time is that, Representative Sweeney?
it starts anytime now.
Okay,
So
everybody, then there's that. We'll start tomorrow morning at 8:30. I think you can leave your papers. I take your computers and stuff with you.